hereby call to order this meeting of the King George County Board of Supervisors Budget Work Session. I'll ask for public comment. Public comment will be limited to 3 minutes per person so that everyone may have an opportunity to speak. Is there anyone here in the audience who wishes to provide public comment at this time? Come on up, sir, and please, when you get there, Chris, can you make sure, is the mic on the podium? And then, sir, if you'll please state your name and address, and as I said, you'll have 3 minutes.
My name is Zachary Dove. I live at 4305 Chesapeake Place. Good evening, Madam Chairwoman, members of the board, County Administrator. As I said, my name is Zachary Dove. I'm a citizen of King George for 3 years. I'm also the president of King George Professional Firefighters and Paramedics, IAFF Local 4438. As you all know, King George has had significant growth in the past years, and I can only imagine where we'll be in a few from now. With that being said, one thing we must stay ahead of is our public safety. At this time, fire rescue is behind the curve on the amount of people it takes to safely do our job. We've made it this far, however, it's only a matter of time before a large event catches us off guard. Based on our minimum staffing of 11, one serious motor vehicle accident, a small fire, multiple EMS calls at once can deplete our local staff resources. When this occurs, we have to request for mutual aid, adding additional time for care. What happens if one of your loved ones has a medical emergency and all of our local staff units are on a call? Some may ask why we're stating we need more people when we're also asking for more money for those that we currently have. We feel this is an opportune time to set a few problems straight. As I've stated, the level of staffing is one concern. Another is with recruitment and retention. Currently, we're not a competitive pay range with our surrounding jurisdictions, Stafford, Spotsylvania, the military bases. Many qualified potential applicants do not even look at us because they can drive an extra 30 minutes to an hour down the road and start with significantly more money. This is also a problem with retention. We get an employee in, get them trained and time, outfit them with uniforms and gear just for them to go down the road and start at a department that'll bring them in the door with a pay raise. Once again, this puts us back at minimum, under minimum, and we're holding people mandatorily. This not only affects their mental health, performance at work, but their family life. I and the 40 members of Local 4438 greatly appreciate your time and hope you deeply consider our compensation and staffing, not only for our safety, but that of the citizens.
Thank you, sir. Thanks for coming out tonight, and thank you for your service to our community. We greatly appreciate it. Is there anyone else here in the audience who wishes to provide public comment? All right, then I will move on to online, and we're going to pause a moment, give Mr. Dines a moment to get back to his monitor. Mr. Dines, do we have anyone online who wishes to provide public comment? You said Brian Henkel? Henkla? All right, Mr. Brian Henkla, if you can hear us, sir, you may go ahead with your public comment. Again, we know your name. Please state it again, though, for the record, as well as provide your address. Go ahead, sir.
Sure. Can you hear me okay?
Yes, sir, we can.
All right. Certainly. So my name is Brian Henkler. My address is 9316 Oyster Shell Lane here in King George. I've been a citizen here for over 20 years. I just wanted to also comment on what was just discussed. I understood that the fire and rescue budget was a topic for this evening, and it's one that I think is an important one that I hope that the board takes in high consideration. I've witnessed and seen the, the challenges that Chief Moody has had, and the the fire and rescue department has had in retention and keeping folks within. And I think it's an important topic that I hope that you know that people out here are watching. And I know it's a complex issue, given our proximity to some of these larger metropolitan areas that can draw. But hopefully, through careful consideration, it seems that the status quo isn't working well. So um, just hope and encourage the board to consider this an important topic, and know that we feel it's an important one for us to go forward.
Thank you, Mr. Hankla, and thank you very much for taking the time to share your comments with us. Mr. Dines, do you have anyone else online, sir? Very good, then we'll now close public comment and we'll move on to budget discussion outside agencies. Mr. Kusenberry, do you have anything to share with us to lead us off?
No, I think we have three agencies here to make a presentation tonight.
Very good. Then we'll go ahead and call Mr. David Cooper from the Brisbane Center. Welcome, sir.
Thank you, and good evening, all. I'd like to touch base on a couple of things. The Brisbane Center for 33 years has been the go-to shelter in this region across the entire planning district, sheltering the homeless of our region. Just in the past 15, 16 years, we've served over 7,000 individuals. Last year on record, we served 30 individuals from King George County. As you can see from some of the information we provided there, 7 of those are children, 3 families, 12 single men, 6 single women, and 3 military veterans. So their average length of stay at the shelter was 56 days. Average cost is $34 per day per person. Cost total is a little over $56,000, almost $57,000. So not only have we provided shelter, we've also provided supportive services for folks at the shelter. The entire budget of the shelter is a little over $1 million per year to operate to serve this entire planning district. I want to bring attention for a moment to something we've discovered over the past 8 years. Brisbane Center has been serving faithfully as the homeless shelter for the region. We've sheltered folks and then expected them to be able to find housing as they exit the center. We've been applying the housing first approach, which is the HUD approach to ending homelessness. What we found is that almost 90% exit to impermanent housing. So part of that system isn't functioning well. The other thing that we found out is that nearly 50% return to the shelter. There's a churn rate or rate of return. So just recently, our board has come together. We've developed a new strategic plan. Our focus is not only sheltering folks, but equipping them for success. So they come in with a certain array of tools in their toolbox. What we want to do is equip them to add more tools to their toolbox so that once they exit the shelter, they have more to work with, more social skills, more hard skills, more opportunities to be able to connect and gain livable wage employment, to be able to locate affordable housing, which I'll speak to more in just a moment. But so we want to equip folks at the shelter, not just hold them at the shelter. I'll mention one other thing that we've done with our new approach. We want to develop some accountability. We want to focus first on people's capability and then help them to be accountable to their own results-based plans for longer-term success. So in the HUD model, there is no requirement for sobriety. There's no requirement for people to have employment. There's no requirement for people to work on their mental challenges. So what we want to do at the shelter is to really focus on how can we look toward people's strengths and to build upon those so they can have more in their toolbox once they exit the shelter. That's part of our new strategic plan. At the sheet that I hope all of you have received, it's not just in the PowerPoint presentation, but there's a separate sheet that I emailed. Basically, you'll see some of the benefits of what we've been doing at the shelter this last year. We anticipate those going up. So I've left 3 folders up there for the Board of Supervisors to look over. That really does describe some of our new approaches to ending homelessness, to sustainably ending homelessness, not just for a short period of time. So if I can get you to turn for just a moment, a couple of slides. I think all of us know that those are some of the issues that surround homelessness. It's not just about putting people in housing with the expectation that they'll self-resolve. It really does take some support. It takes wraparound, hand-up services focused on people's capabilities and motivation. Please. You heard those numbers just a moment ago. I won't go back over those, but at the bottom of this slide, the measure that HUD has required of us in the past is bed nights. How many people stay at the shelter? How long do they stay there? Those are bed nights. That, in my terms, is an output. So it's not an outcome. Outcome is, are you sustainably rehoused for a period of more than 2 years? Do you have a livable wage job? So what are the opportunities that you can focus on, not just how long can you stay at the shelter and what's the cost? Please. You heard this number. I won't go back over that except to draw your attention to the bottom of this slide. We have been faithfully for the last 8 years focusing on how can we participate in the design for the homeless shelter system, the entire Housing First system. We found that only 1% of those exiting the shelter, departing the shelter, do so to the designed rapid rehousing system. That's 1%. So almost 90% are exiting to impermanent housing. Briefly stated, there's an issue, as we all know, in this high housing cost area, that people to be able to have access to affordable and accessible housing. Includes transportation, includes jobs, includes the capability to get and retain a job. Flip over a couple more. So I'm going to briefly touch on this, something that people don't often know. In one of these slides, you'll see that the HUD count for homeless in the area, it's called a PIT count, point in time count, basically indicates that there's a little over 200 homeless across the entire planning district. I want to bring your attention to the McKinney-Vento definition of homelessness. There are basically 1,400 school children that are considered homeless by the Department of Education definition. If you just add one caregiver parent to that, suddenly our numbers are close to 3,000. Those are the folks that are unsustainably housed in what I call low-cost, high-budget hotels and motels. There are the numbers you see across the last 15 years. If you just look at the, for instance, the individuals, the top line, you can see from 2005 all the way to 2019, those are the numbers. But I think importantly, take a look at 08 to 19, that's 11 years. Basically, the homeless continue, that's the PIT count. And you can see the numbers to the right of those that we've served at the Brisbane Center. Yes, sir. So I'm not going to show you this video now, but I hope that the Board of Supervisors will take a moment to follow that link. That's a nice little video that talks about the differences between outcomes and outputs. Outputs are bed nights. Outcomes are, do you have a livable wage job? Do you have sustainable housing? Have you addressed your mental health challenges? Please. So I'm going to basically skip through these slides and just leave those to your consideration. But if you'd be so kind as to just flip over to slide 16 for a moment. That's it. This is a pictorial of our new approach to sustainably resolving homelessness. We start first with people's capability. Do they have the mental, the emotional, the physical capability of gaining livable wage employment? What are they motivated to do? Are they motivated to work on their own challenges? are they accountable not only to themselves, their own results-based plans, excuse me, are they accountable to the organization? Are they using the resources that we have available at the center in an effective way? So that's a quick brush stroke through that. I just commend that to your reading. But I do want to finally conclude with a brief video, if I may. And if there are any questions, be happy to answer those. So this video is an overview of our current focus at the shelter, and it is equipping folks for success, as you'll see. Thurman has been center 32 years. I go to services, income services, it's in Fredericksburg. Here in the 16,000 square foot, last 16 years, we've served nearly 30,000. Mind just stopping that. So thank you very much. So I'd just like to encourage you to take a look at what the center is about these days. Our focus is on sustainably ending homelessness, not just temporarily ending homelessness in subsidized housing or in temporary shelter. And so our new focus is on equipping, it's on sustaining, it's on taking mobility mentoring, which is a results-based approach, and connecting those people in the shelter with a mentor coach so that they actually start in the shelter with the individuals. They'll follow them for 12 months after they exit the shelter. So working on their results-based plan. And so I encourage you, when you have a moment, go to our website. You'll see this video and others without the heightened background sound to give you a snapshot of what we're about at the center. So thank you very much for your time and attention and research. Questions?
Thank you, Mr. Cooper. Question from members. Mr. Stonehill?
I actually do have
Peter?
a question. One of the things I had heard is that you weren't open as much this year during COVID, and you had turned some families away. And I understand the importance of the Brisbane Center. I've visited a couple of times, but I heard that from a couple of constituents. So I told them that I would address it when you came to talk to us. So that's my question for you. You weren't as available to especially families were turned away.
So we have 8 family rooms in the center, and the center was designed that way. We actually have set aside 2 of those for quarantine units so that we have space to be able to quarantine folks that might become ill. And so early on in this process, we took the lead back in March of last year to be able to limit access to the shelter. So one of the ways that we did that is we took half the population of the shelter, placed them at the shelter's expense in hotels, safe social distancing. Those are families and singles. We also kept half the population at the shelter. And so over the months, up until, I'm trying to remember the month now, September, we did limit access to the shelter. We wanted folks who were not COVID positive. We wanted folks who are willing to stay at the shelter and not go and come with regularity, so as to create maybe an outbreak in a congregate facility. So yes, there was a time that we were careful about access to the shelter. I can tell you that based upon, and I just have a letter from the Virginia Department of Health that basically applauded us on our efforts of limiting the total number in the shelter to 48 instead of 80. So as the governor and other organizations lift some of those restrictions, we'll continue to move back up to 80. We're concerned about the potential, what's been called a tsunami of homelessness. We want to be prepared for that. We also want to do so safely. All it takes is to look around at congregate facilities and see the deaths and outbreaks there to have some level of understanding why we took those approaches early on. And I can tell you, no one at the center has been sick, no one has caught COVID, no one has died at the shelter.
Thank you.
Really, thank you.
Mr. Bush?
Thank you, Madam Chair. Thank you for your presentation. And as I'm sure with everyone we're going to hear from tonight, You all do great work, but the question we're looking at is, what are we gonna do with our taxpayers' money? So my question revolves around actions that you would take engaging with the county. So I'm gonna give you a hypothetical, just because I would like to get some clarity. If a family finds themselves homeless and they're referred to, or they engage our social services department here in the county, and if our social services department refers them to the Brisbane Center, one, would you accept them? And two, is there a cost associated with that?
First answer is yes. We currently have family units that are available. According to our coordinated assessment line, there are currently no homeless families in the entire planning district. That's according to the coordinated assessment line. But if we had someone who needed shelter, yes. I can tell you that the Brisbane Center is ready, willing, and able to receive folks today. In fact, we just had a meeting this morning about, are there families who need our services? How can we intake them? Secondly, to your question is, yes, there's a cost. It's about $34 a day. As you saw and heard just a moment ago, it costs the center about $56,000, $57,000 to house those folks coming just from King George County last year. So what we do is we have to fundraise, which is challenging these days, whatever the difference is between what we receive from the county budget and what it takes to actually shelter folks.
So for clarity, so I know there's a cost to you guys. What I'm saying is, if they're sent to the Brisbane Center on referral from King George County, is there a cost assessed upon King George County Social Services to accept that family?
There is no cost assessed against what we operate off of whatever funds we get from the general operating budget of the county. And so that's the funding that we work with. We don't have any additional cost that we pass on or that we request. So if there's, maybe if your question is it has to do with fee for service, there's no fee for service.
Thank you very much.
Really.
Questions from our Citizen Advisory Committee? We'll start with Ms. Thompson. Very good. Mr. Chapman. Ms. Huber.
I'm just curious, would you mind going through this separate page just so I can understand it better with the cost per day and then the cost to serve 30 King George residents and then the funding that you receive from King George, just to
Sure.
explain it a little bit more detail?
And so in our current fiscal year, we will receive a total of $9,500 from King George County. So what we have done is we've said, here's the number of folks that we have actually served that are from King George County. There were 30 individuals, 7 children, 3 families, 12 single men, 6 single women, and 3 military veterans. So what we do is we take the total number that we serve and divide that into our total operating cost for the shelter. That's how we arrive at approximately $34 per day. And then what we do is we take the number of days, average length of stay, which is 56 days, multiply that by the $34 per day cost to arrive at the actual cost associated with housing and providing services for King George County residents, or the homeless from King George County. I want to add this too. Through the grace and generosity of our communities, we receive almost 95,000 meals per year. Those are through the generosity of our community members. And so there is no cost to us to do that. So that's about $175,000 of cost that's not in our budget because of the generosity of our community that comes in. They provide food, they cook the food, and serve the food at the center. Did that answer your question? Surely.
Mr. Say, any questions? All right then. So I did have a question. So on your table, the cost to serve 30 King George residents, you estimated $56,746, correct?
Yes.
And then you stated the funding that this board approved for the current year was $9,500.
That's correct.
So I have a delta of $47,246. I think I did my math right. I couldn't get my calculator to come back on. So that shortfall to take that you take care of citizens from our community, you have to come up with the difference to fund the services that you provide them from some other source. From fundraising is one of the things you said. Can you give us some examples of some of the fundraising that you do, please?
Surely. Well, we have, up until COVID, we were holding annual events, annual fundraising events. We receive grant funding from a whole variety of grants. We receive funding from individuals. And let me say this. There's a person from King George County that faithfully, month by month by month, contributes $10. Those are the kinds of donations that we receive at the center. Sure, there are folks that donate $1,000, $1,500, but those are far fewer. It takes many of those to make up that difference. So the $47,000 you mentioned, yes, we have to take staff time. We have to take focus the organization's resources in raising those funds. Otherwise, we'd be upside down in our budget, and we won't last long like that.
Thank you very much for explaining that. And on a personal note, I've toured your facility. I would encourage any of my colleagues who have not. You do, obviously, I haven't been in there recently due to COVID. It was about 4 years ago. My church youth group, the adults did the dinner because the children weren't allowed to cook, but the children did a donation drive and did have a tour of the facility, and you do an awful lot with very little. So thank you for that. And then one other thing, the children and the families, you have a number of children, 7, and families 3. Are those separate? Are the children double counted? Do you understand what I'm saying?
No, these are all total individuals, which included the children, are 30. So, yeah, so they're not double counted.
Okay. And then with regards to our school population, my understanding, because I worked for the schools for some time, is that if we have King George County school students who require your organization services who have to stay there, somehow transportation is provided to them back to King George to get to our public school. Am I right about that?
That's exactly right. And one of the slides I provided refers to the McKinney-Vento Act. So the McKinney-Vento Act basically is a federal act that says we want children to remain stable in their schools so that wherever they end up, almost wherever they end up, there'll be transportation back. And I can tell you, the school bus and the cars come from King George County, from Caroline County, from Spotsylvania, from Stafford, and Fredericksburg. They come to the center and pick up children, take them back to their school.
Thank you. And then one last question, and maybe I just lost it. I think I did. That's all I have. Thank you very much for coming out tonight.
Thank you all very much.
All right, Karen Delaney, Lloyd F. Moss Free Clinic.
Good evening, everyone. Take my mask off for this. So yeah, my name is Karen Delaney. I'm the executive director at the Lloyd F. Moss Free Clinic. I'm delighted to be here this evening to share some information about our work, and I'm happy to answer any questions. I'll just read a few brief remarks. So a diagnosis of chronic disease, something like cancer, hypertension, or diabetes, is difficult to accept under the best of circumstances, as you might imagine. But if it's compounded with a lack of health insurance, limited funds, or tenuous employment, such a diagnosis can be incredibly problematic. Many people delay treatment until the condition becomes so acute that they wind up in the emergency room, which is the most expensive way to receive health care. And then when the immediate symptoms are under control, the patient is released and the clock begins to tick towards the next crisis. Similarly, routine dental care often loses out to immediate necessities like food, rent, or a child's winter coat. The link between health and wealth is obvious. Healthier people are more productive at work, they earn more, and they spend more time in the labor force. Studies show clearly that better health increases both the number of hours that are worked and the probability that an individual will be employed. And so access to quality health care is important to the well-being of our entire community. Since 1993, the Moss Free Clinic has delivered patient-centered health care to our community's most vulnerable residents. Many of our patients come to the clinic with limited, if any, prior access to health care and struggle with one or more chronic conditions, such as cancer, diabetes, and heart disease. Community support and funding from our local government entities enhances that quality of life for vulnerable area residents who face significant barriers to good health, particularly as they navigate and recover from the COVID-19 pandemic. Since the pandemic arrived, the clinic has been challenged to adapt as never before. We established safety protocols and transitioned to virtual visits for services that didn't need to be conducted in person. We've updated our protocols and schedules to adhere to social distancing requirements. We've monitored the spread and management of COVID-19. We've sought out PPE to protect our staff and volunteers. And we've created a screening process for all patients, staff, and visitors to the clinic, while remaining updated on state and national guidelines. We've achieved much of this over the past year without the aid of many of our volunteers, since many of them have stayed home for safety reasons. And meanwhile, we were forced to cancel our major fundraising event last fall. Our patients face multiple challenges to health, such as a lack of nutritious food and language or literacy barriers. They have high rates of anxiety and depression and extensive oral health care needs. COVID-19 has layered on additional barriers and highlighted inequities such as accessing the internet and having the equipment needed for telehealth visits. They've had difficulty isolating in crowded living conditions, and they've seen loss of employment. While many of our patients were employed prior to the pandemic, many have lost their jobs in the earliest days of the crisis, and they're now doubly burdened by the stressors of poverty and poor health. The pandemic hit our nation and our region hard and disproportionately affected the health and financial well-being of our patients. As the economic implications of the pandemic continue to unfold, more people in our community have become unemployed, uninsured, or medically underserved. The number of people who need our services are going to continue to grow, and we are called to meet that need. It has been quite a year. This time last year, we couldn't have predicted the ways the world would change and what those changes would ask of our community and of the Moss Free Clinic. As we wait for enough people to receive the COVID-19 vaccine and we head into warmer months, we know this isn't over. But it's a good time to take stock of last year, and despite all the challenges, we're so proud of what the Moss Clinic team has been able to accomplish during this time. Just a few highlights. We did not close our doors a single day. Instead, our staff, volunteers, supporters, and community members continually pivoted to meet the needs of the moment. Last March, we began offering appointments via telehealth to keep staff, volunteers, and patients safe while continuing to provide quality care. And in the early weeks of the pandemic, we called over 800 of our patients who were particularly at risk for physical or mental health reasons. And we were able to provide them education, answer their questions, and follow up with scheduling appointments when needed. So for over 27 years, the Moss Free Clinic has remained a beacon of hope and a provider of healthcare for people of the region lacking access to care. There's no single profile of a clinic patient, and they come for a variety of reasons. Some utilize the clinic as their ongoing primary healthcare provider, and they form a long-term lasting relationship with the clinic. Others have a pressing health issue with something that's too acute to ignore because it's interfering with their ability to work. Still others rely on the clinic to manage chronic health problems like diabetes. Some travel great distances with extreme tooth pain and nowhere else to turn. Some clinic patients utilize the clinic consistently over the years, while others come because they have lost their job and with it, their family's health insurance. Against the backdrop of varied personal stories, there is one common thread that every individual that walks into the clinic has, and that is that each receives the same high-quality, compassionate, and personalized attention and care. And we are committed to doing more, reaching more, and healing more. Past 12 months have affirmed our mission while calling us to extend care to even more of our neighbors. We have become a resource for an ever-widening community in increasing need. And all of this has been possible because of people and supporters like you all, your financial support, your creative and committed service, your prayers and your encouragement. And we thank you for helping us serve our community in this extraordinary time. I'm happy to answer any questions.
Thank you, Ms. Delaney. Mr. Granger? Mr. Stonehill?
No questions, but I did want to say thank you, Karen, for coming out. I know that you guys do a great job up there, and I know countless folks that have been up there for, either chronic injuries or, just checkups that need to be get done. And you and the whole staff and the volunteers, just thank you so much for everything you all do up there.
Thank you.
Ms. Bender?
I'd like to know how many King George residents use the clinic. Do you have any idea? Or
In a typical year, so let's not count last year, in a typical year, about 120.
120?
Yeah.
And then my other question is, I know my father used telemedicine in his last year, but do you provide any equipment to people that might have access problems with equipment?
So what we have done is we've given all of our patients, over the past year, we've given all of our patients their own digital thermometer. And we've also given them, our hypertensive patients, their own home blood pressure monitor so that they can monitor their blood pressure at home. We've taught them how to use it, and then we can communicate with the patient via telephone or telemedicine if necessary. As far as the telehealth part, they're able to use their cell phones, assuming they have one, and that's been the primary way, although the telephone works as well.
All right, thank you.
Mm-hmm.
Mr. Bush?
No questions, Madam Chair. Thank you very much.
All right. Ms. Thompson, do you have any questions? Mr. Chapman? Ms. Huber? Mr. Say?
Yeah, just one quick. Do y'all turn anybody away? Is it need-based, or if anybody shows up and needs a service, y'all provide that service?
So we have 3 basic criteria for receiving care at the clinic. One is that they are a resident of the 5 jurisdictions, the city of Fredericksburg and the 4 surrounding counties, of course, including King George. One is that they are either uninsured or have Virginia Medicaid. And the other, and I'll tell you, this is the first time I've been able to say this piece of information publicly, but our board of directors at our March meeting voted to increase the poverty level limits for our eligibility criteria. So we are now going to be serving patients with household incomes up to 300% of federal poverty, which is an increase from where we were at 200% prior. Mm-hmm.
Can you remind everyone, please, what that federal poverty level is, if you happen to know?
So it varies by household size, but
Right.
So at 200%, which I know those numbers much better because we've been using those for so long. But so at 200%, it was about $25,000 for an individual. And then it goes up based on that, depending on the household size. It'll be up to about $34,000, I believe, for an individual once we implement the 300%.
Okay. Thank you very much. Thanks for coming out this evening.
Thank you so much.
And Debbie Foltz, Disability Resource Center. She's the one online. Thank you, Ms. Hahn. Can you hear us, Ms.
Hello.
Foltz?
Yes, good evening. Can you hear me?
Yes, ma'am. Go right ahead.
Okay, good. Well, thank you for having me this evening, and thank you for the past support we've received from King George County for the Disability Resource Center. So I'm going to try to do a quick overview of who we are, but in case I miss anything, the takeaway for tonight is that we're your community organization for disability, and that's cross disability, cross lifespan. When you have a question about anything, you can come to us for that. Our goal is that our communities include all people, and we help people try to figure it out, particularly when someone's had an accident or illness that has changed their ability and changed what they can do day to day. Next slide. And so here's a very old picture of our building, because we do have some better landscaping and we lost that tree. But as you can see, we serve Planning District 16, and then we have a small grant to serve an unserved area of the state over in PD 9. Next slide. So our goal is to help people find their voice and make sure it's their choice to the where they live and how they live and what their lives look like. And so the next slide, our philosophy is people with disabilities have a right to participate in any and all aspects of community living. That guy on the right, the gentleman on the right, is one of our staff. James uses a speech output device. He came to us through a AmeriCorps program that nobody else would take him. And so we said, yeah, come on, and ended up not being able to figure out the AmeriCorps, so we ended up just hiring him. He's also our go-to person for IT. I go in there and ask him questions all the time. And he does our Medicaid billing. So I think because of his significant disability, people didn't want to give him a chance and find out just how smart he is. The next slide. So the important thing about Centers for Independent Living is we're consumer controlled. So what that means is that more than 50% of our board and our staff are people with disabilities with lived experience. We also have some family members like me. I'm a parent of a young adult. I don't know if I can say young adult anymore. He's over 40 with a significant disability. And so that's how I ended up at this cell. But we're community-based, cross-disability, cross-lifespan, non-residential. A lot of times people think Center for Independent Living is a place to go to live. And we promote independent living and equal access for persons with all disabilities. Of course, we're a nonprofit. And our funds come, we have a core grant from the state, all state funds. We do not have a federal grant. And then we are lucky to have local government funds from each one of the localities. Plus we, of course, we fundraise and we have some fee-for-service programs also. Next slide. So a little history about the independent living movement. The first CIL was created with a group of folks at Berkeley. Ed Roberts is considered the father of independent living. Well, Ed ended up being, he initially was denied access to go to Berkeley. When they finally figured it out, he graduated and ended up being the commissioner for VR, voc rehab for the state of California after he was given that opportunity. Next slide. There's 17 CILs in Virginia. We're one of CILs. We're funded all differently, but we all have the same core services. And so next slide, you can see where they are across the state. There's two areas of the state, the Farmville area and Culpeper, that have no services or little services. So as a CIL, next slide, we all have the same 5 core services that you see here, and you can go to the next slide. So peer mentoring, we used to call it peer counseling, but people got confused with licensed professional counseling. It's not that at all. It began with the IL movement, and now particularly mental health services are often provided by peers, people that have had that lived experience. And then independent living skills training. We do this on an individual basis at our office, in somebody's home, out in the community, or we can we do some group things. And like right now, because of COVID, of course, we've been doing some online YouTube videos in training. And so we did a nice series on employment, some cooking, just lots of different things that people would ordinarily come to the office for, but we're doing it, and we're getting better at it too. Next slide. Advocacy, another core service, and so it can be state, federal, local government advocacy. It can be advocating for change in the community. Anything from when you trip over the sidewalk and you see it needs to be ground down, and you call the local government and ask them to do that, to helping change policies and procedures, plans. Right now, we're taking a look at all the local government's comprehensive plans to see if they could include the needs of people with disabilities and the elderly in a more intentional way, particularly when it comes to building and programs that sometimes people with disabilities are not included in. What we do the best at, though, is help people to learn how to advocate for themselves. Self-advocacy is such an important thing for people with disabilities because oftentimes they lose their voice when they have a disability, particularly those young adults that have a horrific accident and go home to mom and dad after they've been on their own, and then they just kind of get stuck. Mom takes over making sure they're getting their care, and they may get on benefits and not know how they can actually work during that benefit time, and maybe even work well enough to get off of benefits and still maintain their health care, which is always the issue. And so we try to help people understand all of those things, but it needs to come from that individual. So we help them. If they need to write a letter, they need to write a letter. We can help them use the right language or tell them who to send it to, but we want them to take responsibility. We're also very fortunate that we're right between the state capitol and the federal capitol, so we can go to hearings on different things and represent people with disabilities. Next slide. INR are obviously our largest service, and if we don't know it, we will figure it out for you. So anytime somebody has a question, whether it's a phone call, a process, or something as broad as what's the difference between Medicaid and Medicare. And I know some of you probably know, but a lot of people don't even understand their own benefits. So sometimes as we're working with folks, we're helping them understand. A lot of times people call for one issue. I need housing, which we're not a housing agency, but we try to help them get to the root of the problem about their housing they have now, or what can we do to help them change their situation, help them understand what Voc Rehab can do for them, or what other opportunities there are in the community. Next slide. Transition is two different services. That this fifth core service became a core service just several years ago. Two things: leaving high school to adult life, and nursing homes to community. So our kids, a lot of times kids with disabilities have gone through school and they are able to graduate with a regular diploma, even an advanced diploma, but yet they haven't developed those skills. They never did the social skills. They can't maintain a job and or go to college without the direct support of somebody telling them what to do and when to do it, because they never had to do that. And so we try to help them. We've had groups. We usually have a group of young adults, and that helps them network with each other and see what other people are doing. And then we'll do individual. We'll work with kids getting ready to leave school. Nursing home to the individual's home, well, they may not have one, so that's always a challenge because you're in the high rent district. But a lot of times people end up in nursing homes because they don't understand how many community services are available or how they can negotiate those community services to maintain their housing. Nursing homes are expensive. If you take that money and put it towards what you need in your home, a lot of times people can do it. A lot of times families don't understand if they have an elderly parent come in and move with them, that they can still go to work and they can hire somebody else to come into their home and help them during the day and have time for somebody to take care of the basic activities of daily living for their loved one. Next slide. We do lots of additional things. I mean, each cell looks at their community and what are the opportunities and what are the needs. We do a weekly exercise and nutrition class. We just started to do them live online. She had about a dozen that she had on YouTube, but I think today was the first day that she's trying to do it live with them. And the idea is we get people moving and understanding what they can be doing, and then refer them to the YMCA or another place to go and do it more regularly than the couple hours at our office. We have a certified ADA specialist who does assessments out in the community. We've done training for some of the local governments. We've done training for businesses. We've done assessments for the businesses, and so people can come and ask a question, and she can direct them in the right direction. The next slide. Equipment connection. Probably all of you have heard about. This is not a core service. It's something that just evolved over time with the Disability Resource Center, but yet is our largest program. We take in durable medical equipment, gifts from the community and the Rappahannock Goodwill, and we have a staff member that cleans, repairs, gets things all set up, and then gifts them back out. So if anybody needs anything, they just come to the site. It's on Princess Anne Street, and can get what they need at the time. There is no criteria as far as financial and or prescriptions, except for power chairs. And we hope that the people will donate it back to us when they no longer need it. Oftentimes it's a temporary need. It can be a temporary disability. It can be a person with a disability that their equipment is broken and they're waiting for the insurance company to approve something new, or somebody that's newly disabled. We've had people that were offered from their insurance company more rehab or equipment, which that doesn't make a bit of sense to me, but it has happened. And so we give out over 2,000 pieces of equipment a year. Last year, I think we gave out 123 pieces of equipment to 76 residents of King George that we had documented. And so as far as our total service to King George County, we had 165 individuals that received direct services from us. One example is one of our staff actually lives in King George. She came to us through the Title V program as a volunteer. So she's elderly, and she worked under that program. Then we hired her, and so she's continued to work with people who are deaf and hard of hearing. And she wrote that she was working with a consumer in King George who has hearing problems. Her husband was in the hospital with stage 4 cancer, and she couldn't not understand the doctors. And so it was thanks to our Giving Back Sound program that we were able to get hearing aids for her, and she was able to communicate with the doc regarding her husband's condition, and she's better able to function after his death now that she can hear what's going on. So the Giving Back Sound program is much like the Equipment Connection. It's a reuse program. When you don't need them, when people have them and they don't know what to do with them, they give them to us, and then we give them out to people that have a need and hook them up with an audiologist that can fit them to their needs. And so we just don't give them to them. We help them figure out how they're going to work for them too. So I don't know if anybody has hearing aid issues, but they're very expensive. And so oftentimes people go without because they can't afford them, or they can only afford one, which sometimes it doesn't work for folks. Next slide. So with our children and youth, we've had youth groups in the past that came to the office, and we don't currently. We took them to Washington, and we took them to Richmond, and we helped them learn how to understand their disability, how to become good self-advocates, how to plan for their future, and really empower them to be in control of their lives in a positive way. Next slide. Currently, we have an empowerment group. It's a group of people with disabilities. They have gone through several different courses on different independent living skills training. They share information with each other and support each other. We've had very impressed that when staff wasn't able to be in the meeting, participants took the lead on it, and so they've done a great job with that. And then the end with a bingo game every time because they love that. Next slide. Other services, workshops, lots of different workshops, and this is where we'll come out into the community, go to the libraries or with the school districts and provide workshops on Medicaid, Social Security, just lots of different things. We do. We've done some series, chronic disease self-management. We have staff that are trained to do that, and that's a 6-week program with individuals helping them take control of their own health and more responsible for their health. We'll come out and go to groups and speak about DRC or anything else. We do have some support self-help groups. We have some groups that use our building because we have a terrific location. Like the Parkinson's support group meets at our office, but we are not actually conveners of the group. We just provide them the space. Then we do a lot of collaboration in the community. There's lots of different groups for youth and children, and our staff attend about 50 different meetings across the community and across the state. The Public Transit Advisory Committee. There's lots of different ones that we try to represent the needs of people with disabilities. Last slide. And at the heart of our philosophy is all about people with disabilities have a right to participate in any and all aspects of community living. That little guy on the left is my son, and I think they're at Mott's Run doing an educational program up there with the group that he attends. Other things that we do, it just depends on what's going on. This year we were able to benefit by getting a grant to help the community, and we ordered 150 emergency preparedness bags and gave them out to our consumers. And there's such a need for people to understand personal responsibility and preparedness. So we got books for them and helped them go through these notebooks and develop their own emergency preparedness plan. So they at least have an idea of what they need to do in case of a disaster, and not expect that emergency responders are going to be at their door right away. We know a lot of people that live independently but require personal attendant services and do not have somebody else in the home with them to help them in case of an emergency. So it's really, really important for them to take responsibility on developing their own plan. And the last slide just is our contact information.
Thank you, Ms. Foltz. We'll take questions.
That was really fast.
Mr. Stonehill?
No questions, just thank you for coming to speak to us tonight.
Ms. Bender? Mr. Bush?
No, just thank you for the presentation.
Oh, you're
Ms.
welcome.
Thompson?
Hi, I have a question. You mentioned that you receive funds from state, federal, and local governments. Do you also collect or receive payments from the individuals that you serve or from their insurance companies?
No, we there's never a fee. for individuals to have services through the Disability Resource Center. And we can have a short-term relationship or a long-term relationship with people depending on their needs. If somebody's newly injured, they may have a very long relationship with staff person to get back to understanding how they what they need and helping them develop a plan to live well with their disability.
Thank you.
Mr. Chapman? Ms. Huber? Mr. Say?
Yeah, you mentioned 165 King George citizens. Is that over the past year, or what's the time frame?
Yes.
Okay, thank you.
Uh-huh.
And I don't have any questions. Thank you very much for joining us for the presentation this evening.
Oh, you're welcome. Thanks for having me.
So with that, we'll move on to Department of Social Services. And Mr. Jonathan Franklin is here to present.
Good evening. Series of handouts for you guys. So from my understanding, you all, after reviewing our initial budget proposal, had questions regarding our new positions, the CSA increases, and the outside agency supports. So what I've put together for you is a packet that outlines each one of those categories, a series of documents and supporting documents that show the trends of our agency and the pretty significant changes that we're facing given federal and state mandates. And I'll just walk you through and figure what would be most prudent and keep us on topic is we can address each category at a time so we don't get confused. So I'll start with the new positions. So the first sheet there is essentially my justifications. So back in January, I provided our board. We have an administrative board with our proposal, which was passed on to you. In that proposal, I recommended a series of increases, essentially a 5% increase across the board for our existing staff. And found out this month that from the state, they are also adding a 5%. That was mere coincidence on my part. I did not foresee that. And then also, those proposed salaries for the new positions they are comparable with our neighboring agencies. And in looking at our internal alignment of employees, the recommended salaries, essentially, the max we are looking for any of the new hires is about $45,000 with benefits. So that's where that $60,000 comes from. And a large part of the reason we are requesting increases is there are significant discrepancies between our agency and our neighboring localities as far as compensation for our employees. It has immediate impacts on our retention, which is a statewide issue that our local, or not our, the Virginia League of Social Services Executives has really been pushing over the last year. So there was the budget proposal that is one of the attachments. Then you'll see a series of graphs that show our trends. And really the recommendation for 3 new employees, I realize that is a large request. It is a decade in the making. Essentially, I see us as being a decade behind in our staffing in all 3 of our units. I think these positions could have gradually been integrated into our staff. But ultimately, I see this as a realistic need for us to do our job and do it well and thoroughly. In the graphs, you'll see a consistent rise in caseloads. So in benefits across the board, SNAP, TANF, VIEW, Medicaid, we see those numbers go up. In our family services, we have our CPS numbers continue to go up each year. The complexity of those cases increase, number of investigations versus family assessments. One thing to note on page 9 in permanency. So permanency is our foster care and our adoption. So these are children who are in our custody or have been finalized for adoption. Since 2011, we have seen a steep drop in our foster care caseloads, which has been fantastic, and it has been very strategic for us. We've tried to focus our attention on prevention services rather than removing children and placing them in our custody. But although that number did drop over time, our adoption cases have gone up. So although permanency has fewer kids in foster care, we have more adoptions that require monitoring the adoption subsidies that we provide families, post-adoption, and any post-adoption services that we may need to monitor. So that's permanency. Mentioned the SNAP benefits. And then our protective services, investigations, just the number of CPS referrals that we receive, family assessments, and to break it down for you, in child protective services, when we receive a case, if it is valid, it is validated either as a formal investigation or a family assessment. Essentially, what we do with the family is identical. We engage the family, we identify the needs, we take protective actions if necessary. The only distinction is that investigations typically involve law enforcement, joint investigations, and they tend to be more serious in scope, a little more time consuming as well. But ultimately, I mean, when you look at the trend lines across the board, our program areas continue to rise. And that brings me to the last graph on page 14, our staffing, which it's not even a flat line, it's a decreasing line. And we are a small agency, so every time we lose an employee, we feel the ripple effects across the board in the program areas. And so I think that trend line speaks for itself. We've lost people. We have retention issues, and then a couple things that have directly impacted our case carrying positions. The CSA coordinator, who last June moved from the county finance department to our agency. She occupied a benefit program specialist position. So that is a position that was doing Medicaid, SNAP, TANF review, and is now managing the CSA account. So we've lost a case carrying position there. Back in July 2018, we had never had a family services supervisor. That position was created from an existing family services specialist position. So it happened to be me at the time. I carried a full caseload of CPS cases and then managed the entire unit. But it is that position cannot carry a caseload. We have 5 programs that supervisor oversees. There is a lot of compliance and auditing that we routinely have to do with the state. So we essentially lost a services position because we needed a supervisor. So those are the staffing trends that I have for you. The next bullet point is that we have new mandated programs. The Family First Prevention Services Act is a federal law that has made its way to Virginia. Essentially, we were supposed to start that in, I guess, 2 years ago. but the state wasn't ready to implement it, so it was delayed, and then COVID hit, so it was delayed again. Come July 1, it is in full force. It's going to mean increased case management. It's going to mean increased financial reporting and accountability. And ultimately, what Family First is the federal government is telling us how we can use their Title IV-E dollars. Title IV-E can pay for foster care. Essentially, it has only paid for foster care up to this point in time. What Family First is now doing is opening those federal dollars up to prevention services. So what we typically have used through local funds or grants that we apply for through the state, we will be able to use, if they qualify and if the service is available, we'll be able to use those federal dollars. But every time we use federal dollars, we have to account for it. We have to manage it, and we have to report it appropriately. So it will be increased work, and it is a steep learning curve. The state is still training us. They are still developing trainings for us to even understand the program and its full impact on us. So I wish I could tell you I knew what was coming our way, but I don't. And when we get into the CSA discussion, I can also touch on how the Family First Prevention Act will impact that potentially. One positive note is it's not a new program, it's a rebranding of a program. Our prevention services they've never had a formal policy manual by the state. That is now changing. So the state has now branded prevention services. So this is anybody who is engaged in child protective services, or maybe they have a screened out CPS referral, but we can engage them with some support. Say they're dealing with homelessness or financial insecurity or substance abuse. That's always been called foster care prevention. So it's essentially community-based services to prevent kids from coming into foster care. The state has rebranded that as in-home services. And you'll see in one of the attached letters, we will be receiving July 1 a state allocation of $58,788 this coming budget year with no local match. This is due to the expected increase in all the changes for the in-home program. However, next budget year, that amount of money will have a 15% local match, so it'll be run into our baseline budget. If I were to go back to the recommended positions, this essentially covers one of those positions. If we're only looking at $60,000 to cover a $40,000 position, this state allocation for this year will cover it. That does mean next year there would be a 15% match, as with the majority of our other positions. So those are the new mandated programs. In my few months as director here, I worked very closely with our interim in a transition period, and just kind of reviewing all of our programs. There's a lot of risk and liability in all the changes that we face, and in our current number of employees. Our programs are increasingly complicated. Policy changes happen day to day at times currently, as they are writing policy. Our cases are much more complicated, and all of that is it can lead to risk of payment errors in benefits and administration, which can lead to financial reimbursement that we have to face. We have increased program reviews, audits, quality assurance, and accountability through the state in all program areas. That has increased significantly in family services. So our CPS and foster care cases, 16 years ago when I started, I'd never even heard of a case review. Now it is nearly monthly. They are reviewing one of those programs, which has increased scrutiny on us and increased work and reporting. And then just to note that The CSA coordinator position, if you're familiar with the history of where that position came from, that was essentially created out of an audit. So we had never had an audit in the CSA budget before, and frankly, to be honest, had little state guidance in that area. And so we were faced with significant risk in that multi-million-dollar budget. So the CSA coordinator position was created and started at the finance department. I think that is a key example of where I don't want us to be. I don't want us to create employees and positions as a reaction to errors. And then regarding our state budget, it is a big question mark for me. It's a big unknown. I don't know the number yet. I've talked quite a bit with my counterparts in our neighboring, in Planning District 16. What I can tell you is I included a budget letter that documents the 5% increase that I already mentioned. And if you're not familiar with how the reimbursement of our budget is laid out, I included essentially the cheat sheet that shows you all of our state budget lines and what the federal, state, and local contributions are. With regard to these positions, we have 3 budget lines that we pull from. One is our base, so that's the majority of our staffing and operations. That has a 15.5% local match. Then there's a pot of money that is reserved for Medicaid. It essentially came to us when Medicaid expanded. It's a much smaller pot of money. There's no local match to that, so it's 100% federal and state dollars. And then there's our pass-through, which has the highest local match of 66%. So the bulk of our budget does come from this 15.5 or 0% match. So that's the state budget, notes on the state budget. And then finally, we just have a genuine need for county investment in our agency. I do see us as being a decade behind. I do think we could have made these requests incrementally rather than 3 at a time, but I do think it's a realistic need based off of the work that we need to do. As I mentioned before, we have employee retention and recruitment issues. This is statewide. King George County, we don't compete with the Northern Neck. We end up competing with the rest of Planning District 16. Maybe not so much with Caroline because they pull a lot out of Hanover and maybe the Richmond area. We are very similar to Caroline DSS. But across the board, there was a memo sent out by our league that indicated that DSS salaries lag 11% behind comparable Commonwealth of Virginia positions and 10% behind Virginia Department of Social Services positions. So we compete with them. In 2019, local DSSs experienced 19% turnover. Family services specialist positions especially, that's your entry-level social workers, experienced 35% turnover. And then over the last 3 years, we have lost 3 services employees to other agencies. We've lost 2 benefit employees. That's essentially half of our case carrying employees that we've then had to recruit, try to retain, train, and start from scratch. It's been a huge deal for us. So I do realize they are large numbers before you. I understand the financial environment we are all in, but I do think this is a realistic request based off of our program needs. So I think with that, I will leave that topic with you and go for any questions.
Thank you, Mr. Franklin. Mr. Granger, do you have any questions, sir?
Yes, ma'am. Sir, thank you for coming out. Thank you for the brief. Thank you for the information. It was a lot of information, and, but I really do appreciate it. So I was looking at our big Excel sheet of requests from last time that we had. I was just trying to understand Children's Services Act. On there it shows an FY22 department request of $3.7 million. Over here I see what looks like it shows projected to 3.4 million. Is there a reason for a $300,000 delta in those two?
Okay, so I hadn't touched on the Children's Services Act topics yet.
Oh, I'm
But,
sorry. Yeah, I jumped way ahead. Then
No,
I
no, no,
apologize.
that's okay. I'm happy to address that. Yeah, so that is based off of our current cases. So that $3.4 million projection, that's our current cases. We have one case alone that is not in that current pot of money because he's currently 4E. However, given all the changes with Family First Act, he's currently in a residential environment. He will most likely not be eligible for 4E reimbursement, which means potentially $300,000 could be, in one case, could be transferred into our CSA budget over the course of a year. So, but that's only one child. In addition to the Family First changes, we have new mandates that all in-home cases have to be sent to FAP, the Family Assessment and Planning Team. That's the first team, service level team that makes the service recommendations that ultimately go to our Community Policy and Management team, which handles that CSA account. We potentially have 30 or more cases in a given year that could be added to our CSA budget. I don't know if any of them will actually require that funding, that level of funding, but I do know there's a good chance that the one case alone, this one child in foster care, will no longer be eligible for $4E, and if he's not picked up by Medicaid, that $300,000 will automatically roll over into this account.
Tracking. Okay, I'll go back to staff then. I apologize for that.
Gotcha.
So I appreciate the graph here for staffing in particular. Back in 2011, it shows there were a total of 23 positions, and today we're at 19 positions. I'm going to be honest with you. I don't remember during our the ones I've been part of, previous budget work sessions where we've reduced, and so we're taking away positions from Department of Social Services. Could be wrong. I just don't recall. And so I came on in 2016, and in that year there were 21, and so it's gone down by 2 over that time. What has happened? Were they unfilled, and how did those positions just disappear?
So, I mean, I was not in the position that I am in now. Back in 2011, I did work at the agency.
Understood.
If you notice, there are unfilled positions. So, I mean, this is going off of our state data. So, the state will give us as many positions as we want. What we actually fill and can actually fund is a different story. But yeah, so I mean, you will see back in 2011 we had 20, 2012, 18. You know, and it kind of consistently goes down to 2020. We're at 17. So no, I mean, this board certainly never took away positions from us. Some of the change. May be in just basic vacancy or inability to fill a position, or a program change. But given our current staffing now at 17, we need to be back at that level of 20. We are performing at a much higher rate and a much higher caseload than we were back in 2011.
Tracking. So you have 2 unfilled positions. Do you have funding for those unfilled positions currently?
That's why I'm here.
Okay, I apologize. I took unfilled to mean funded but not filled.
No.
Apologies. So across the top then, what you're showing there is what you, over the history, the gap about the number of positions that Department of Social Services needed versus what they had.
Correct.
So back in 2012, it was a 5-person discrepancy.
Correct.
Okay, thank you. I misunderstood that completely, so thank you for that clarification. I don't have any other questions at the moment.
Mr. Stonehill?
To say welcome and thank you, Jonathan. I haven't seen you since you got your new promotion. But yes, you had a lot of work to do from years past to clean things up and to get those things. My only question, just making sure that there are other folks that are not coming. You don't serve anybody from outside of King George, correct?
No, we are strictly, our jurisdiction is only within King George County.
Well, not that we know of. Right. Yeah, I just wanted to make sure that, I know in the past, I've heard a lot of complaints from folks coming across a bridge, coming from other areas. I mean, I know that's something that you all have to really keep an eye on, for folks not living in King George and getting benefits. So just want to make sure that, well, hopefully if you get a couple more people, they can, keep an eye on that a little bit better. But I don't have any more questions. I just want to, just to bring that up. I hear that a lot.
Yes.
So,
So we have a system called Paris. It's an electronic system. I believe it's for all 50 states that essentially helps us track those. So if someone has applied in King George County, but they receive benefits in Maryland, Maryland gets flagged, they contact us, vice versa. So there are safeguards in place. We also have fraud. We don't have a full-time fraud worker, but we handle fraud in-house through our caseworkers who then refer that to a supervisor. So those safeguards are routinely addressed.
okay, thank you.
Ms. Bender?
I have just a clarification question. So a lot of the budget that you're requesting is needs that you have addressed that haven't been addressed for a little while, state mandates and new positions that really need to be filled due to caseload, correct?
Correct.
And I'm sure you could even think of more that we need, but this is what you really need to function.
Yes.
Okay, so I'm looking at, this is from our other worksheet that our county administrator did, and it, with understanding that there would be state aid involved, it's almost $1 million in need, correct?
Correct.
All right, I just wanted to clarify that. Thank you.
Mr. Bush?
Thank you, Madam Chair. So in full disclosure, I am the Board of Supervisors member of the Board of Directors for the Department of Social Services. So I took part in the budget discussions. So I'm going to start at the bottom and then work my way up, if that's okay, Jonathan. So the Board of Directors had discussed outside agencies that they would like to support. And on here, I do see Safe Harbor Child Advocacy, okay? You're asking for a $5,000 local contribution to them. And I see that you did capture the $1,400 cost associated with a child that has to be referred for those services. So just for a point of clarity, if the county was to participate with Safe Harbor Child Advocacy Center and we paid $5,000, there would be no individual charge or carry-on services charges for the county to cover if we participate with that organization. Is that correct?
Correct.
So it's actually a return on investment
Absolutely.
for that. Okay. So with that, I fully support that organization. I'm not as supportive of the others, but I just wanted to make that point that this is a fiscal return on investment. So you were talking about the 5% that the state is looking at. So you're not suggesting, or it's not captured in here, we wouldn't be looking at something that would eventually manifest as a 10% raise, correct? So between the 5% that you had requested and then the follow along with what the state is talking about, it's not going to be a 10%. You're looking overall at when it comes out in the wash, 5%, correct?
Correct.
Okay. Thank you very much. And then I want to make sure I'm not talking out of school, but Mr. Granger brought up a good point. So with the positions. So I've been on the board of directors even before I was elected. So I believe what happened is your predecessor would lose positions. Those duties still existed. They would be carried over to someone else that was working within the department, and he had what was considered a pool of money then to be able to compensate employees at a higher rate. And I think that's ultimately what happened to those positions, why they weren't filled. But I can tell you from sitting in our meetings, they're a lot different under Mr. Franklin's direction. You're very thorough. Thank you very much. But the need for staffing with all the additional state mandates that have come, and there's a lot of regulation for state and federal that they're having to juggle. I don't see how they can handle those caseloads. So I support the additional positions. Thank you, Madam Chair. That's all I have. Thank you, Mr. Franklin.
Ms. Thompson, do you have any questions?
I think just one. On page 20, the percentages and numbers you're getting, the 11% salary lag and the 19% turnover, et cetera, those are statewide numbers, is that correct?
Correct.
That page is not
Yeah,
specific to King George,
correct.
correct?
That's statewide. That's a state trend.
Thank you.
Mr. Chapman? Ms. Huber? Mr. Say?
Yeah, just one question. I think you mentioned, you've had to replace 5 employees. Is that over a year, over multiple years? What's the range?
Can you repeat that?
Yeah, I think you mentioned that you've had to replace 5 employees, which you got to retrain, those kinds of things. Is that this year, so you've lost a third of what you have, or is that over multiple years? What's the range?
That's over the last 3 years.
3 years, okay, thank you.
I don't have any questions for you, Mr. Franklin. Great job. Thank you so much for coming out, and thank you for all you do for our community.
Absolutely. Do you need any additional information on the CSA budget discussion?
I think if
points?
we do, we'll have Mr. Cusenberry get in touch with you, and then you can provide us a follow-up. Thank you. All right, so moving on, new position requests, Sheriff's Office. Welcome, Sheriff Giles.
Thank you, Madam Chair. Good evening, Madam Chair, members of the board, and the Citizen Advisory Committee. I've been asked to come before you tonight to discuss my request for 2 new bailiff positions. Per Virginia Code 15.3-120, the sheriff is responsible for security at the courthouse. King George Courthouse has 3 courts that run. There's the Juvenile Domestic and Relations Court, General District Court, and Circuit Court. From July 2020 to present, there was roughly 160 days of court. 33 of those days had 2 courts in sessions at one time. To provide proper security for the courthouse on the days that there are 2 courts in session, it takes a minimum of 7 bailiffs. 1 at the public entrance, 2 in each court that is in session, along with 1 in each court to serve as a runner to escort defendants that are in the holdings awaiting their time in court. Also, when a defendant needs to speak to their lawyer, it requires a bailiff to be available to escort the defendant in and out of the holding cell to the interview room. Along with security for the courthouse, the bailiffs also provide transportation of defendants from facilities that they are being held at in the court and then return them back to those facilities. And on occasions, the bailiffs also handle mental transports, which can take them anywhere in the Commonwealth of Virginia. Some of these transports, by our policy, which is 60 miles, over 60 miles or over 60 minutes, requires 2 deputies to do these transports. In July 2020 to present, there's roughly 44 1-deputy transports, 25 2-deputy transports to be completed by court bailiffs. 10 of the 2-deputy transports were while we had court in session, therefore taking no bailiffs away from court. 9 of the transports were done by road deputies. When the bailiffs are handling these transports while court is in session, it requires me to take a deputy off the road to assist in covering the security for the courthouse, minimizing the number of deputies on the road and therefore extending response times for calls for service to the citizens of King George. From July 2020, there were 41 deputies that were pulled from the road at an average of 4 hours, totaling roughly 520 hours that the deputies were off the road being able to provide security for the courthouse. The information that I just provided, that's in the perfect world when we have all the bailiffs that we have now working and they're not on vacation and in training. During this pandemic, I've had to supplement some of the needs by using our SROs in the courts. With the schools going back to the in-person learning, I don't have that luxury anymore. I have actually assigned a full-time road deputy to the courts for the time being to assist in the need. I will need to return him back to the road at the end of May. Currently, I have 4 full-time bailiffs and 1 part-time bailiff. If you grant me the 2 full positions, it would eliminate having to pull deputies and SROs so frequently to properly protect the courts while they're in session, when a bailiff's either out handling transports, vacation, or in training. When the courts are not in session, if I'm granted these two positions, I'll take 3 bailiffs. It will take 3 bailiffs to properly secure the courthouse when they're not in session. And then I can utilize 2 additional bailiffs for civil process and other deputies as I see fit. In 2020, a little sidebar and information, under the Virginia Code 15.3-120 Section D, King George County collected an estimated over $11,000 from courthouse security. I appreciate your consideration for this matter, and I'll take any questions if you have any.
Thank you, Sheriff Giles. Mr. Granger?
Yes, ma'am. I'm just trying to recall, I know last year, I believe you came with, was it a request for 1 new position last year?
It was.
And so obviously that got nixed like everything else with COVID. So now you're saying 2 is what you need.
Based on the influx of the court cases that have been backed up and the more courts that they're going to be having to get caught up and
Tracking. Okay.
Yes.
That helps me understand. My only other question would be, the budget for 21 for the sheriff's department shows 4.8 million. Is that because of an influx of, I shouldn't say influx of cash because that's not really the best way to put it, but from CARES Act funding, and so that pushed up the dollar figure until, do we, I just don't recall, I don't recall that we didn't adopt I didn't think we adopted originally a $4.8 million budget for sheriff's department, which would have been a $500,000 increase from fiscal year 20. So I'm just trying to figure out what the delta is for that, if anyone happens to know.
Go ahead, Mr. Kuzma.
Yeah, we'll have to look, I wasn't here, but
Understood.
we'll have to look into that and we'll get you an answer.
Okay. My guess is CARES Act funding. So it gives an appearance of more dollars, but that was because we used for public safety. So that's all I have. But I appreciate you coming out. I appreciate the presentation. I think we knew you had the need last year. Obviously, with what happened, that's the way it went. But I think it's important that I think this is an important request. I think we need to do this. So.
Mr. Stonehill?
Not really a question, but just thanks for coming out. And it's, if we needed one last year and one this year, we'll certainly do what we can. I mean, I know firsthand how short everybody is, and I know that Lieutenant Govan's doing his best over there with a short amount of people, and the guys having been pulled off the road to cover the bailiff. So I'm sure we're going to do whatever we can to get those 2 positions.
Thank you.
Ms. Bender?
I don't really have any, but thank you very much.
Thank you.
Mr. Bush?
Thank you, Madam Chair. Thank you, Sheriff, for coming out tonight. So with the current courthouse situation, we know it's not adequate for spacing, which is why we have approved the construction of a new courthouse. The position that the sheriff requested last year was nixed due to COVID. I would like to see us be proactive where we're not in a reactionary posture anymore, to where whenever we transition to the new courthouse, we already have the staff in place to be able to man it properly. Just like what we're going to be looking at with the schools. We did a middle school expansion. Now we're going to be looking at staffing to be able to fill that. I would like to address the sheriff's request because it is a current problem right now with the crowd and the interactions. And then as COVID dissipates and things come back to normal, it's going to be back full steam ahead. And we all know how problematic that was prior to COVID. So I support that. And this is probably a sidebar and a discussion later on. But I think with the opportunities we have with the cigarette tax coming online, there's some things that maybe we can do to dedicate a portion of that towards public safety and look at that down the road to pay for some of these positions. So thank you very much, Sheriff.
Thank you, Mr.
Thank you.
Thank you.
Ms. Thompson?
Hi, Sheriff. The current courthouse has 3 courtrooms, you said, sometimes 2 are in session?
No, ma'am, we have 2 courtrooms.
Okay.
3 courts that occupy those rooms, and at times, both of those courtrooms
Yes.
have courts in session.
And will the new courthouse be designed in the same way?
They'll actually have 3 separate courtrooms.
So possibly a need for
Yes, ma'am.
more.
They could potentially have 3 courts going on at the same time. Yes, ma'am.
Mr. Chapman?
Yes.
Ms. Huber? Mr. Say? All right, I don't have any questions. Thank you very much, Sheriff, for coming out tonight.
Thank you for your time.
All right, new position requests, emergency services, Chief Moody.
Members of the board, good evening. Before I get started, I want to certainly thank you for this time and opportunity to come. The theme tonight that I want to touch on are actually two items. So first is the new position request, and then the second, I want to discuss some of the recruitment and retention challenges that we've had. Thank you. That we have had over the past, certainly over the past year, even dates back, even going back to possibly even 3 years. We have the big request and ask tonight. We have requested 9 new positions. That's a big ask. Just as a background, because I'm not sure if everybody's familiar on how our fire and rescue system operates in our county. Unlike other jurisdictions, our department is the only fire, rescue, and emergency services department in the county. There is no other B team. There is no other stations, no other departments. We have 3 stations that cover 183 square miles. Okay, that's everything from the Westmoreland County line, Stafford, Caroline, and going up to the bridge. So anytime someone calls 911 and they say, I'm having a heart attack, I've been involved in a motor vehicle crash, someone's loved one overdosed, their house is on fire, whatever the case is, those calls come to us. So there are no other departments in the county. The last time we have funded in the county positions for our department was in 2016 for new positions. We have not added any new positions in our department since 2016. A lot has changed in 5 years in King George County, certainly over the past year. In 2016, when we added those positions, we got over $1 million grant from FEMA to get those positions. Last year, in order to keep those positions, we had to fund them locally. So we felt the impact of those positions locally to our county budget. And thank you to the board for continuing those positions. Let me give you just a little bit. I want this PowerPoint to really facilitate the conversation and not read to you every single thing in the PowerPoint. Certainly PowerPoints can be monotonous. And if you want a copy of this, you probably don't have it. I'm certainly able to send it to you, email it to you, so you can go back and see it later. This slide right here shows what our current staffing levels are 24 hours a day. This is a 24-hour shift. This is our current staffing levels at Company 1, Company 2, and Company 3. And Company 1 is right down the road across from Food Line here on Route 3. We call that the courthouse station. Company 2 is in Dahlgren. It's off Dahlgren Road as you're going into the main gate. Company 3 is our station in Fairview Beach. So the current staffing at Company 1 is 7 positions. So it's 7 o'clock in the morning, 7 positions come in, they get off 7 o'clock the next morning. The recommended staffing levels back in 2011 were 11 positions. This was the state came in and said, we are going to do findings and our recommendations to King George County on what your staffing levels should be for your fire and rescue department. So the current recommended staffing levels is 7. We have a difference of 4 per shift. At Company 2, staffing is at 5, the recommended's at 7, and at Company 3, staffing is funded at 3, and the recommended 6. So you can see the total differences. That where the difference is between shift and total is that there are 3 24-hour shifts. This is so we can seamlessly provide service, because we have to have a new group of people work on A platoon, a different group of people work on B platoon, and a different group of people work on C platoon. And every shift has 15 firefighters, EMTs, and paramedics. That's if we're fully staffed. The difference that we're at today is a net staffing difference of 27 positions. And that's based on a 2011 through 2016 standard. And we're in 2021. So the 9 positions were for 6 firefighter EMT paramedics and 3 lieutenants. And the lieutenants are still a firefighter and an EMT, but they're a working crew leader. They are part of these numbers. It's somebody there that's the next step above, the entry level supervisor, if you will. So these aren't office positions when I say lieutenant. These are a working crew leader. Before I guess I can really, we talk about our need, is a lot of people really don't know what we do. And they know we respond to 911 calls. They know we go to fires and we go to medical emergencies. And I would encourage you to, if you have questions from your neighbors or citizens, let them see these numbers. This is what we did in 2020. We have a great workforce in our department. They're very dedicated. They all want to do a good job. They are truly very well-engaged public servants. Over 3,700 calls total in 2020. Almost over 3,400 emergency medical calls. We transport to basically 5 different hospitals in our region. We also transport to the one over in Maryland. You can see we went to Mary Washington there over 1,800 times in 2020. 135 times to Spotsylvania Regional Hospital. 33 times across the river over to La Plata. While Chris is getting that back on, the point I want to say about this is that I'm not going to tell you anything you don't already know. We don't have a hospital in King George County. We're called to the urgent care facilities in King George County. When the patient is too severe that they cannot handle it at urgent care, they pick up the phone, they call 911. Our department gets the call. We have to go there and address that problem. When the nursing home has sick residents or injured residents, they pick up the phone, they call 911. These are heavily taxing to our department. One of the very unique challenges about this business, you never start the day and you never look at your monthly planner calendar and say, this is what's going to happen then. There's no RSVPs in 911 work. Certainly Mr. Stonehill and Ms. Kupke, you're certainly aware of that. But nobody calls and says, I'm going to have a car crash at this time. Get ready. Be prepared. They expect our department, they expect public safety to always be prepared. We had 1,107 fires. The dollar saved in fire loss was over $6.6 million in 2020. Dollars lost was over 1.2 million. So you can see we had quite a bit of a ratio difference. This is all the EMS calls. You can see the number of motor vehicle crashes, the amputations, the chest pains, the cardiac arrest, OBs and deliveries, 39 overdoses, and the list goes on. 27 people in cardiac arrest, 20 suicides. And I would encourage you to share this with your constituents and your neighbors. They have questions. What does our department do? Why do we need help? We can have the best stations, we can have the best trucks, but if we don't have the people to handle these calls 24/7, you can wrap the whole thing up and throw it away. This is a breakdown of fire calls. 38 house residential structure fires, 2 commercial building fires. You can see the automatic fire alarms have increased, water rescues. We're out on the Potomac, we're on the Rappahannock, we're in the presidential lakes. We do it all. This is just an average, some 2020 response stats. Our average response time on calls throughout the county is just a little over 9 minutes. We want to do better with that in the years to come. We have plans. We want to put a station in the Shiloh district to minimize that response time on the eastern end of the county. Average on-scene time is 18 minutes. Average EMS response time is 6.84 minutes. Its average transport time to the hospital is over 30 minutes, and our average transport miles is over 23 miles. That's going one way. That's not coming back. That's just transport with the patient. We've had 156 calls to the newer Mary Washington Urgent Care off of Journal Parkway. Mary Washington Hospital operates that urgent care. I estimated in 2019 when they opened that it would be anywhere between 130 to 165 calls, and I've got a fairly close number. We're there pretty much on a daily basis. We have urgent cares, one that's over here by Fastmark now. We have an urgent care that's up there at the old Battlefield Century 21 building. We have Minute Clinic at CVS. We're in all these places. We respond to calls to all of them. We've had, you can see, 1,650 urgent transports to the hospital with patients, 326 non-urgent. I will tell you, and this number is not on here, but it's a point I want to drive home. We have a moral, an ethical, and a legal duty to provide this service to people. The state law says we must have a capable system as a local government to answer 911 calls. We also have that same responsibility to people that don't live in King George County. 235 patients that we transported out of that number are not residents of King George County. They're commuting through, they're visiting, they stop by a convenience center. And if they have a heart attack and they call 911, we have the same obligation to them as we do any King George County taxpaying citizen. Just some, we've been tracking this for a few years, how many percentages of units, these are individual units that are understaffed and failed responses. Engine 2, which is the main primary fire suppression engine in Dahlgren, 30% fail to respond to calls. This is due to staffing. 27% of the time that it did respond to calls, it was understaffed. An understaffed engine is less than 3 people in our department. The national standard's 4. You need to have 4 firefighters on a fire engine to really do all the functions when you pull up to a fire at minimum. We run with a minimum of 3. But the reality is that we don't have enough people, so we are actually dropping down to 2. And when we do that, we have to take personnel off the ambulance to then get on the fire truck. Engine 3's in Fairview Beach with a 69% failure rate. 29% of the time it responded was understaffed. You can see the same for Tanker 1. Tanker 1 is our tanker here at Company 1 here at the courthouse. Rescue 1 is our heavy rescue. This carries all the jaws of life, the extrication equipment, all the things we have to respond to on motor vehicle crash, 20% fail and 2% understaffed. Engine one, we have permanent staffing on that engine. That's the engine that pretty much responds all over the county. That engine is the permanent staffing fire truck in all of King George. Pretty much covers every border boundary that we have. That's where those numbers right there are where my goal is to get at Company 3 and at Company 2. Because when we don't have that response, lives are at stake, property's at stake, and we could have a very serious situation on our hands. Okay, so I want to steer the conversation back into what our request is this year, and something that might be a little bit of news for the board. When we applied, when we submitted for the positions at the beginning of the budget cycle, since then, the federal government has funded the FEMA Safer Grant again. We have applied for that same FEMA Safer Grant. However, we applied for it last year, we didn't get it. We applied for it the year before, and we didn't get it. The last one we got was in 2016. But it was available and it was open, and we wanted to try for it. So we wouldn't know whether that we would get that funding probably up to the latest September, October timeframe. So my request would be that any new positions that we would certainly wait till not before then, and possibly push it out to maybe mid-year funding in January. So some of that fiscal cost impact could be reduced this year if we decide to fund some of those positions. Certainly, if we do get the notification that we did get the Safer Grant, I will be back here to the board saying we've got some good news. It will require ultimately your approval, because this is personnel and it's a staffing. Where we're at today with positions, I have 5 vacancies right now. 5 vacancies. And I can't fill them. And that's a dilemma, and that steers this conversation into the recruitment and retention part of it. But here's the problem, and I'll go through this pretty quick and these other slides fairly quickly too. But bear with me, please. Our current pay scale is based on an open range system. Almost all of our competitors are on a grade step system. And so employees know where they're going to be if they're with an organization 3 years, 5 years, 10 years, 20 years. And it provides reassurance to them. We need to move towards that type of system, in my opinion, because we are losing people left and right because of that. Our increased living costs are outpacing the wages that we're paying our people. I say I certainly live in King George, but I have a lot of employees that don't, and they say I can't afford to live in King George. I got to live in Westmoreland. I got to go to Richmond. I got Richmond County. I have one employee that lives in Rockingham County. So this is a challenge we have is paying people enough wage, and so they could possibly live in our county. We see aggressive recruitment by other localities. This is an economy 101 issue. We have a short supply of skilled positions and what the skill set we're looking for, and we have a high demand. And anytime you have a short supply and a high demand on anything, whether it's human capital, personnel, gasoline, lumber, it's going to raise the price up. And since 2016, the county did a pay analysis study with our market comparators. And since then, and especially over the past 2 years, we've seen the market leap and jump in salaries and positions more than I've ever seen in my tenure here at King George. from 2018 to 2020, 2 years, we lost 19 full-time positions. 19 full-time positions. I only have 45 in all of operations. I was here with Dr. Young, Sheriff Giles, and we were here in this very same room about this time last year. And it was right at the onset of our COVID. I think we all remember keenly aware of that. And we brought some of this same message to you then, and we put together a plan, and thank you for that. Thank you for seeing that there was an issue. However, I don't have some of the best of news to share with you, and that is, since from then to now, we have lost another 12 full-time positions. I had to change a slide. I had to change a slide literally today from 6 part-time positions. We lost 12 full-time and 6 part-time positions. I had 5 on there yesterday. I received another resignation from a part-time person yesterday. We have numerous employees that are out there aggressively being recruited. Our competition wants what we as King George County have invested into these employees. They want that. They have no bones about it for us to invest our money, our time, our experience, only to say thank you for training them, and we're going to take them, we're going to pay them $20,000 more. Thank you. Could you do a few more others for us? We need some more. And we got to break that cycle somehow. And I don't have all the answers. I got some recommendations. I don't have all the answers. Some of our problem has led to pay compression for tenured employees versus new employees. Recruitment's being pushed further away. We're having to go out further and further to different localities to find skill sets. I wish we could find them all here in King George, but we have employees all down the Northern Neck. And we're having, and every locality is in the same issue. But because of these staffing shortages, in order to meet our current demands, I'm asking employees to work more and more and more and more hours. So what is that? I think everybody understands when you ask employees to work more and more and do more with less, you have employee burnout, you have preventable accidents that are occurring, you have excessive overtime hours that are being worked, and this is something that we have to break that cycle on. Our people in our positions, they're already working 56 hours a week, and that is the average work week. That's with no overtime included. We're asking people to work nights, weekends, and holidays. We're asking people to work when there's inclement weather and snow days. That don't matter to us. We're at work. When there's been lots of virtual teleworking this year with lots of different occupations, we don't have that luxury. We can't do that. We have to be there to answer 911 calls. I know this is a big transition of a slide. I knew at this point to get everybody's attention. These are 2 actual employees, and this is the point I want to drive home with this. There's probably no other positions that we invest in more outside of a deputy sheriff. I put a deputy sheriff in this category too. There's no other positions that we monetarily invest in more than our public safety, our firefighters, our EMTs, our paramedics, and certainly the deputy sheriffs. These are 2 actual employees, and I went through and looked at the cost of what we had to pay to get these people trained and get them on board. Employee number 1, the only difference between employee number 1 and employee number 2 is employee number 1 I did not have to send to the regional fire academy. Employee number 2 we did send to the regional academy. Our regional academy, who we partner with, is Spotsylvania County. Also one that pays a whole lot more than we do. The regional academy is anywhere between 5 to 6 months in length. So they're working right beside 20 other Spotsylvania new recruits, and they talk. We invested almost $28,000 in employee number one. It's taxpayer money. An average set of turnout gear is over $3,000. A physical is $800. A written exam, when we do a written exam for a pool of people, $750 to pay for the written exam. So that's $750 whether you have one person take it or whether you have 100. My goal is to put this investment back into our people, because we're paying it. I believe we have lost hundreds of thousands of dollars in the past couple of years because of this issue right here. The gear anymore, I've heard people ask, Chief, well, why can't the new person just use the old person's gear? It don't work that way. Not anymore. Years ago, it used to. You used to grab a pair of boots out of the locker, grab a jacket. You know, if it didn't fit that right, oh well. Now everything's custom tailored. One of the indicators that you know you have a recruitment and retention issue and you have a compensation issue is when you can't recruit people. When your applicant pool is just not there, that's an indication. This was last year. We had 43 applicants total. 15 that met the minimum requirements, which are fairly minimum. 6 applicants of the 15, 6 of them said that they would RSVP and confirm to show up at the test. 5 of the applicants actually showed up that day. 6 said they were, 5 showed up. 4 of them passed. And in that base, 0 of them were any medics, were any advanced EMTs or paramedics, didn't have any of those certifications. And all 4 would have to take a 6-month training academy back in Spotsylvania. We've seen a steady decline over the past 3 years. We have a current recruitment process. We've gotten to the point that we're actually listing our app. We're doing an open recruitment announcement that runs pretty much all year. If you go to county website right now, you'll see those positions. And you'll see that the expiration date never ends because we're just constantly always recruiting positions. We couldn't do we're listing it for 2 weeks and then we're closing. We wouldn't get anybody. This is the current numbers. This is the current numbers. It's not November, December. That's an error. We have 44 applicants right now that have applied. 14 of them met the minimum qualifications, and 4, when we tried to set up a test, 4 of them said they'd show up at the test. And when that happened, when I heard that we had 4 people that said they were going to show up to test, for $750 I have to pay the testing company, I did not think that that was a wise investment. This is before we even get into background checks, polygraphs, find out if they have any felonies or DUIs. This is way before that. So right now, we put it on hold. We're going to try to readdress it maybe later in spring or summer. I want to go through this real quickly, and then I'll certainly open up to any questions. I just want to show some of the differences. I went through, and some of these numbers have changed slightly due to COLAs and different things. These are actually individual, true, real people that I pulled at the time. True, real employees. And you can see the differences in the salaries. And I want to say, I hit 3 of our main, what I would consider our main competition that's driving the prices up. That's NDW, Stafford, Spotsylvania. But folks, the reality is that the truth be told, every county and jurisdiction touching the borders of King George County is paying more than we are. And that includes Westmoreland County. And that's just a facts. A King George firefighter EMT recruit is at 36. You can see the differences in the salaries there. And people will tell you, because they have. They did it 19 times in the past couple years. They'll say, Chief Moody, thank you. I had a great learning opportunity. Thank you for all. But in order to better my family and to better, I gotta go. I got a new job offer. And they're paying. And I say, what are they paying you? Well, they're paying me, $15,000, $20,000, sometimes $40,000 more. Here's the key factor: doing the same job, working the same hours. Firefighter EMT with 5 years, you can see the differences. NDW, our base fire department in Indian Head and Pax River, $35,000, almost $36,000 difference in annual base salary. Firefighter paramedic entry level, you can see the differences there. A master fire rescue technician, you can see the differences there, $21,000, $22,000. A lieutenant with 17 years in our department that's also an ALS advanced life support provider, you can see the differences there. A battalion chief with 20 years in our department, it's a shift commander, responds to basically in charge of everything that happens on that 24-hour shift. You can see the differences there as well. Westmoreland's a little bit unique. Westmoreland County doesn't have a paid fire and rescue department. They have a paid EMS department. And EMS is a little bit different because they cannot, under the Fair Labor Standards Act, they cannot work in excess of 40-hour work week without being paid overtime. We can. And so we work 56 hours, and that other 16 hours is not paid at an overtime rate. But in EMS, if you just do EMS, that is not exempt. There's only one other occupation that's exempt in that, and that's law enforcement. Law enforcement's exempt with that, but EMS is not. When you look at the hours worked, they work in Westmoreland County, they work less hours. They work 2 24-hour shifts in a 7-day work period, 7-day week. They have 8 hours of automatic overtime each week. There's a difference of almost a little over $11,000 in our pay versus Westmoreland County. And my recommendations in closing is to create a public safety pay schedule based on a step and grade system, kind of what I talked about. It would include annual cost of living adjustments as necessary, and that would be implemented in the upcoming budget year. I think we have. I don't know if we can afford to keep kicking this can down the road anymore. We're staffing a station with 2 people. I got 5 vacancies. If I got dropped a number of resignations right now, this week or next month, it's very likely that I'm going to be having to notify the county administrator we're shutting down stations. I only got 2 people at that station. That's a very likely scenario. We may have to even look at adjusting Company 2 in Dahlgren. I can tell you that our mutual aid responses, and I have it on one of these slides, is quite of an increase of how much mutual aid that we have received from other jurisdictions, particularly NDW, on the base. And they, this year, actually put us on notice about that. And the comment was, it was the only comment they had. How can we approve these developments that are going to put more strain on their system under our current mutual aid agreement? And what are we doing to fix it? And folks, the reality is that we cannot fix the need to add new positions in our department to meet the public needs until we fix our recruitment and retention problem. We can't do it. If the board gave me funding for 9 new positions tonight, I couldn't fill them. That's just a reality. We need to increase our certification pay amounts. Stafford County's paying an annual $10,000 for paramedic certification. Spotsylvania paying $7,000 for paramedic certification annually. We're paying $3,000. I think we need to bump that up. We need to increase our VRS, which is a Virginia retirement system. We need to increase our Virginia retirement system multiplier. We're at 1.7. What they allow is a 1.85. This has been a recruitment hurdle for us, trying to recruit people in these counties and jurisdictions around us that have that 1.85% multiplier, because our VRS benefits, retirement benefits, are not compatible. The health insurance is something we talked about. I won't touch on that, but when you retire from King George County today, you won't have any more health insurance. And so we're asking our firefighters and our deputies and our paramedics to come here, work 20, 25 years, be a good, faithful public servant. If you started out at 20 years of age, maybe you could retire at 50, 55. But the reality is, thank you for your service, but you don't have any health insurance. And health insurance is not affordable. It's not affordable. So many of our folks are finding themselves having to work till they're 65, doing very hard labor task jobs, just so they can go right into retirement, right into Medicare. And then the last but not least is just a market. In order to prevent us from getting in these kind of challenges and these situations, we need to really look at doing a market analysis every 5 years, maybe sooner, if the market changes, maybe sooner, but at minimum every 5 years. Because if we don't, we're going to continue to get this much further and further and further behind in the marketplace. In closing, I just, again, I want to thank you for your support for our team. We do a lot for this community, and I think you know that. I didn't want to bring you pictures of car crashes and house fires and things, but you know what we do. And I would encourage you to, I'm going to get this on our website too, get it out on Facebook, but to let people know, what is your fire and rescue department doing for the community? And I think if you look at those numbers, you can tell we're not a whole lot of sitting around. So thank you for your time and your attention, and mostly your support. So thank you.
Thank you, Chief. You could maybe even do another infographic with some of the numbers you presented tonight, if you were so inclined. Let me go ahead and start with Mr. Granger for questions.
Yes, ma'am. Chief, thank you for coming out, and thank you for the brief, the sobering facts of the situation. So 9 new positions. So essentially three full-time. I know it's 9 positions, but it's 3 full-time positions really to make sure that someone's on call all the time. 3 new bodies all the time. Correct? Is that the idea?
That's correct.
Okay.
3 that's correct.
So
right.
3 people on call all the time. In addition, which means 9 new people, so to have 24/7 coverage, 365 days. Okay. 1 lieutenant, and then 2. You said it was 2 fire and EMS.
Yes. So in that, looking at just the 3, there would be an additional crew supervisor, the lieutenant, if you will, that would work on that one shift,
Yes,
along with the other 2 firefighter, EMTs, or paramedics.
Would they all be located at one facility? Like, do you have a plan for? Would it all be at Dahlgren? Would it all be at?
They would go between Dahlgren and Fairview Beach.
Okay.
Yes.
I don't have any other questions at the moment. Might want to come back though.
Mr. Stonehill.
Thanks, Chief, for coming out. Great presentation like usual. This is definitely something that we've been dealing with for a lot of years on both sides of the house, on your side and Sheriff Giles's house. And I know we talked about it last year pre-COVID, and, you know, we had those 5 points that we were gonna try to hit on. Unfortunately, we only got to do, I think, 2 of them. But it's something that we definitely need to do. You know, it seems like King George is always behind the curve. You know, we're short people, and we bump up to where everybody else is, and then we all find ourselves short again. So we're always seem to be playing catch up. But it seems like we need to fix the pay before we do the 9 positions, because I guess if the pay is not there, it's going to be hard to find the 9 positions, correct?
That is absolutely correct. And like I said, if you gave me funding for 9 positions tonight, I couldn't fill them. I can't get the applicant pool. I can't get the skilled people to turn an application in, and I think that is again a driving force of what people are seeing. You know, the recruiting has. Let me just add, the recruiting has drastically changed in the past 5 years. Certainly over the past decade. Hardly nothing's ever mentioned in newspaper, classifieds as far as positions. When a position's announced, it's now uploaded on Indeed. So a lot of the applicant pool comes from Indeed. We see a lot of the applications are from out of state, and we're asking people to come in and have a process, written exam, physical agility, an interview, and we just know that's not going to be typically feasible for people that may not meet any of the certification requirements and apply for that. But back to your point, Supervisor Stonehill, that the pay has to be addressed, because if it's not addressed, then we're going to have a hard time to struggle to meet those positions to provide the service to the county.
I know from the sheriff's side, does anyone here in Virginia, they do any type of contract with new employees saying that you have to be here for X amount of years or you're responsible for paying back training costs?
So that's a great question, and the answer to that is that we already have that in place. In fact, we had it for 2 years, and just this past year we increased it to 3 years. Okay, there's a little bit of and a lot of people we see, they've been here 2 or 3 years, and then right at the 2 examples I provided you, they were right outside of that envelope. So I did raise it up another year. I think it could get a little bit watered down if you pushed it out and said you got to be here for 5 years or 10 years or something of that nature. But a lot of places are 1 year or 2 years, but we have extended ours to 3 years because of this recruitment retention challenge.
Well, it just seems like we're a training facility for folks that jump ship, after we pay for it. So
I agree.
Well, it's something that we really need to do. So I'm sure that we are going to do our darndest to address the pay retention positions for both sides of the house. Something that's, we've needed for a long time. And with all these folks coming in and more houses coming in, there's more services that are required for all of you guys. So it's, we've got to fix this problem as opposed to just kicking it down the road. But thank you again. Thank you, Mr. Dove, for your speaking as well.
Ms. Bender?
Thank you for answering my questions the last couple of days. One of the questions, I've been talking to a lot of citizens recently, and they come up with many questions on the schools, public safety, and they want to know what is the difference of why we've turned more to a paid system for fire and rescue as opposed to the old volunteer system. So that's my first question.
Well, that's pretty complex, but the easy answer to that is that we still have volunteers, and I don't want it to sound that we do not. We have roughly about 35 to, give and take 40 active volunteers. However, volunteering is becoming very hard for people to do, to meet the increased training standards, give the time necessary to do it. And I don't think I think, even yourself probably have experienced that. It's hard to get, sometimes people to accept these volunteer roles and then, certainly to do it in our business, in our capacity. If we had 200 calls a year, we could do that with the volunteer system, but we can't do it with 3,700 calls a year. It's just not a reasonable task. We find that people are having to work multiple jobs. There's lots of social and economic reasons of why that has faded. And we're not the only ones that have seen drops in our volunteer numbers. It's happened region and statewide. Volunteer departments in Spotsylvania and Westmoreland, a lot of them have closed up over the years, and they were at one time very active organizations. But that's probably the real reason. If you know of somebody that's willing to come out and volunteer and wants to do that in this capacity, send them to me because we have an interest in that. Our volunteer, I'll give you an example of the difference between work hours. Work hours for a paid person is anywhere between 216 to 250 per month of work hours. Work hours for a volunteer is anywhere between 12 to 18 hours a month. So just the work hours alone of what we're asking people to do is considerably different.
Well, that's the first question. The second question is, because there's always a debate between COLA and merit. So fire and EMS, which, from what I saw, you feel the more is the COLA based than merit based?
If I can approach the board, I got a couple examples here, and I'll just
Jeff's the passer.
I'm the passer.
Thank you, David. Oh, Stafford. I'll take one.
I've already given you all. I provide that as an example because it may help answer that question a little better, Ms. Bender. So the COLA is just a cost of living adjustment. Typically, that COLA is there to really keep up with what's called a consumer price index, which is on average like 1.9% per year. So if you made the same amount of money and you always made that, the price of the dollar is increasing through inflation faster. So the money, the worth of your value of money is constantly keeping up with that. So that's typically what the COLA is. Where we're at is an open, the whole county, every county employee is at an open pay range. And so we can start out, but then there's no guarantee of what the next year or next year or the next year is going to be. And if you look at the examples that I showed you, this is what Stafford, what Spotsylvania is doing, and it's what the federal government's been doing for years. And it's what a lot of the departments, and I'm not even picking up Northern Virginia. Westmoreland County's on a step grade system. I believe our school system is on a step grade system. And this is something that has been a real challenge for our industry because people, they just can't see, where they're going to be. I think it was in one of my slides, but the pay for performance model that we had stopped in 2007. So that was the model we had, was a pay for performance model. And the better you perform, in theory, the higher percentage you could get per year. But it had to be funded. And that was the problem. We went through a recession, it stopped being funded, and it never really came back. And so, th- this kind of addresses some of that. It's saying when a person moves from year 1 to year 2 to year 3.
Thank you. And my last question is there any other incentives besides just increase in pay that could maybe help with the gap? As example, maybe giving a tax credit on their car, the personal property tax, or a credit on their property taxes if they live in King George and they're serving as our fire and EMS or even our sheriff's department. Is that something you've looked at also?
We do that for our volunteers. State law allows that. I don't know if state law allows you, would allow you to do that. I'm not sure. That's not my bailiwick, but because I deal with it with their volunteers, I know that that laws are very particular on what you can and can't do with that.
I'm just looking for other ways that might incentivize and make it more attractive to come here.
It may make it attractive to maybe recruit employees to live in King George County. If it was a, say, $600 a year personal property bill, it's not going to change a $15,000 difference. I'll just be honest with you. It's it's just not going. I don't think we would see. But some of that out of box thinking is I think necessary for. I don't know if the answer is just all pay, but I will tell you that where we're losing people to, it's because they're paying them more money.
I understand. I'm just trying to think, as you said, out of the box. We have a lot of needs, and we don't want to raise the taxes sky high just to address all the needs. Just trying to think of other ways. But thank you very much.
Mr. Bush?
Thank you, Madam Chair. Chief, thank you for coming out tonight. Thank you for all the conversations we've had. Thank you, colleagues, for letting me serve as our liaison to the fire department. So, Mr. Granger hit the nail on the head. Sobering. That's the word he used. This was sobering. So I'm looking at this through a couple of lenses. So to my constituents in the James Monroe District specifically, I am concerned about Company 3 at Fairview Beach being shut down. If the current staffing trend continues, that will be the fire station that's shut down. It happened before. And look how long it took to get that thing manned back up. And now it's only manned with 2 people, okay? If you're very familiar with Fairview Beach and Potomac Landing, that wind whips off the Potomac. If I have a fire in Fairview Beach, I better have more than 2 people at that fire station. So that is very concerning for me, is that it's not just a potential, if this trend continues, the likelihood of Company 3 being shut down is a reality. So for my constituents and the lens of being the supervisor for my district, that's very concerning. Mr. Dove, thank you for coming out tonight, giving the comments, sir. And so a couple of things that were hit on. King George is a recruiting pool. We're not out recruiting. We are a recruiting pool because of the situation that we're currently in. We have firefighters driving $1 million pieces of equipment that are going to Sheetz to get a soda. And if you look at what they make per hour based on the hours they work, they can make more money at Sheetz handing hot dogs through the drive-through window. Do the math. It's a reality. That is problematic. We worked very hard last year in trying to find a way to make this a priority, and we did. This board stood up and said public safety is extremely important, and we still lost 12 firefighters since that point, and 6 part-timers, correct?
Correct.
Again, problematic. The step grade system that was presented tonight, the schools use that. The schools had those steps put in there. If you remember a couple years ago, before my time, there was a heavy tax rate increase, but that was to address their retention issues. King George County had a problem with recruiting. It was a revolving door for teachers coming in and out. They had to do something. They put in something similar, and it's working. So I especially if you're competing with that, I cannot blame somebody for going into your office saying thanks but no thanks. I can drive 10 minutes further down the road and make $20,000 more a year for my family. We all have jobs or we're retired, but that's what we worked for, was to support our family, not for fun. So, and I'm going to sound harsh here, but when I call 911, it's going to be a competition with the schools. My first grade teacher's not who I'm hoping comes down my driveway. Public safety is number one, because what good is education if you're dead? That's one thing to consider. The other thing I know firsthand, that we rely too heavily on mutual aid, because when my wife got kicked by a horse and she was laying on the ground for a little while, Naval District of Washington showed up at my house. Wasn't Company 2, wasn't Company 1, it was Naval District of Washington. So we have some serious problems that we need to address, because the county's only going to grow. The bridge is coming, so you're going to be responding to more traffic accidents. Same thing for the sheriff. They're going to be responding to more traffic accidents. Everybody says, well, you're pulling rates in comparison from these Northern Virginia and higher paid jurisdictions. Why aren't you looking at the Northern Neck? Or look at somebody that's similar in population. Well, that's one way to look at it, but I could drive 10 minutes to Stafford. Why? I don't care what Westmoreland makes if I can get a job in Stafford making more money. That's that's who we're competing with. And we're in a dire situation. Last year we tried to make it work. Now, here's the positive spin on this. I think we can address this financially. We're probably getting CARES Act funding coming in. Last year we used CARES Act funding to address public safety salaries. I believe that's still going to be the criteria for the new money coming in. Also, thanks to the hard work of this board, and one of the very few things that I agree with the General Assembly on, we now have taxing authority on cigarettes. That should be effective in 1 July. We should have a dedicated line from that tax to public safety. Between those two, I think that can cover this. So, something just to consider. Thank you very much for your presentation, and sobering. Thank you.
Thank you, Mr. Bush, and I absolutely appreciate your advocacy on behalf of Chief Moody's department as the fire rescue liaison. I just want to make sure everyone has time to ask the questions while he's here, and then I'm sure we will have more spirited discussion later on. Thank you. Ms. Thompson, do you have any questions?
No questions. I just want to thank you for your presentation, and thank you and the folks behind you for what you do.
Thank you. That means a lot. Thank you.
Mr. Chapman? Ms. Huber?
Yes, thank you. So my only thoughts with this whole discussion, and I completely agree with Mr. Bush, I am a teacher in the county, and I 100% would rather have someone who is, equipped with saving my house, my life, whatever, than my, music teacher showing up at my driveway. So my thought here is, I understand the COLA and how that works. I wrote down that the 2007 pay for performance stopped. I don't know why. If anyone knows, I'd like to know, because we've been kind of throwing around the whole merit pay the last couple times I've sat in. I'm new to this whole thing, so I'm kind of learning. But I feel like as a teacher, you can't always rely on the COLA. So I would rather see maybe us look outside even further than the COLA, and so you're not recruiting people saying, hey, we have these step increases for you, and then, we didn't get our funding, you're gonna now be at, the same step you were last year, so, sorry. So I would just know, I would be curious, is there anything better that we can provide to, recruit more of our teachers and our firefighters, because we have seen a retention issue across the board. So why go into a COLA when we already know it doesn't always work? So that's my thoughts on this kind of discussion.
But, if I could, I'd just address that, just slightly. So that would be the importance of a step pay system, is that from year 1 to 2, regardless of a COLA, you would be moving to that step. So that would be where they see, an employee says, look, I'm at 40,000, and next year I'm at 41.5 or 41. And they would see that progression. And then what a COLA would do is fluctuate and increase the entire, changes all that. It would be, if it was a COLA of, let's say, 1.5% or 2% to keep up with the cost of living, then it would be that next step, and the COLA. And let me do mention this. There's nothing to say that if you have a poor performing employee, it's not meeting the standards, that they would move to the next step. So I know sometimes we get caught on, what if you have a performing poor performing employee? Well, they're not just going to keep going through that step grade system. That matter's addressed, or they're out of there. They're not going to be doing the job. So that would be at minimum, they're meeting satisfactory performance to move to the next step. In 2007, I think a lot of that was just recession. 2008, our economy crashed, and it was like that. We were in a very low economical period nationwide for many years after that. And what we've seen over the past several years is that it's been more based on tenure. We moved to a couple different models, as if you've been here over, like, say, 5 years or 10 years, you got a different percentage. So.
Thanks, Chief. Mr. Say?
Yeah, great brief. A little bit even scary when you're showing us 2060 numbers. It's kind of scary to see if they really 2021 numbers, what they would look like. Just one question. I'm assuming with the staffing situation in Growth County, is it a safe assumption that the response times are getting worse?
I don't know if they're getting worse than the 2020. I think they're still pretty much on keel. Our real big challenge is that until we can fix the problem of being in 2 places at one time, we can't be on the road transporting somebody to the hospital and be responding to Mr. Bush's 911 call. And that's a challenge. It's not that we just decide we don't want to go to a call, or it's because we're not available. We're either at Mary Washington Hospital in the city of Fredericksburg, or we're on the way, or we're coming back, or we've had to take staffing, what we call cross-staffing units. We're trying to take the same people to put on a fire truck that's also the same people that are on an ambulance. And so if they're on an ambulance and they're down at the hospital and a fire call goes out, no people on the fire truck, or understaffed units. And that's what my request is trying to fix.
And one other question, are we having to rely more on outside entities like NDW and others to help? Is that request going up?
That is.
Okay, thanks.
Just 2 questions related to the SAFER grant. Remind me, is that 3 years, and then after the 3rd year, the locality has to absorb 100% of the cost? It's 3, correct?
That's correct.
And what's the local match again?
This year, they've changed the requirement. They've changed it. The local match is 0.
Ah.
So and that not only includes, if you get it, that
Right.
only includes salary. It also covers benefits.
The benefits too.
So it's
Okay.
retirement, health insurance, life insurance. It doesn't include gear or physicals or any of the onboarding stuff, but it does fully cover those other things.
Okay, and for how many positions did you apply for the SAFER grant?
We applied for the same positions that we did last year, and that was 6. So even though my request was 9 to you, here's a challenge with SAFER. The more you ask for, the less chance you get getting an approval. So I wanted to get less, ask for a little bit less. since it was also the same, kind of mirroring this request we had in previous years. The more positions you ask for, the more reason you have to justify of why you cannot afford them as a local government. And that's what we have to be prepared to answer.
Right. All right. Mr. Granger, did you have an additional question?
Yeah, so it makes sense. Everything's tailored, all the equipment, and so obviously when people leave, that's a challenge. What happens to the equipment? Is there any way to like retailor it? Can it be reused, recycled? What's the? Is it just thrown away?
Well, we do reuse it. If we have somebody that can fit in it, then we'll
Okay.
give them a pair of pants, a different jacket, or whatever. So we definitely reuse it.
Okay.
Here's the problem with that gear. It's got a 10-year shelf life. As soon as you get it, it's good for 10 years.
Regardless of whether it's being used or not.
That's correct. So it sits on a coat hanger for 5, that's 5 years gone. So that's a challenge. The other, and typically, if the employee in that agreement that Mr. Stonehill touched on, if they return the gear, unless we had to really go out and get them like a full custom new set, if they return the gear, then we don't typically charge them for that unless there was something that had to be custom. The reason why we don't do that is because if they were paying for the gear, then they would say, well, it's my gear. I just paid for it. I'll just take it with me.
Mm-hmm.
And we don't really want that to happen. But it's a significant investment, significant cost. We've even had employees that don't return the gear. And one I had to go to a magistrate and file warrants out for because they didn't return the gear. And so we deal with that. The physical is a big cost because you can't get that back. So that's one we definitely charge for. But the gear, we do reissue it, and we do have a uniform room of gear.
Tracking. And so I guess the other thing, Ms. Huber's comments about the steps, at least when I heard what she was having to say is it still has to be funded. So if there's, if the budget's looking to say, hey, we need an extra 20,000 in order to meet all the step increases, everyone moves up. We didn't have everyone retire. We're not, because obviously at some point it's going to cycle, and so you save some money at some point. But the current board can't obligate a future board to pay for something. So if the board doesn't fund it, it doesn't happen. Is that a correct statement?
That's absolutely correct. The only thing the way I would look at it is that it's the same way you fund payroll right now.
Correct.
For all county employees. Now the difference is that you're exactly right. There may be a $30,000 difference in increases the following fiscal year because people are moving up at the different steps because of tenure.
Mm-hmm.
That's kind of really what you want is that tenure. We want people to say, hey, I'm moving from year 7 to year 8. And that's part of the selling package behind this. But there is some financial burdens that come with that.
Yes, and so I was just trying to bring up the point that it still comes down every year. The board has to make that decision to say if there is an increase in order to provide that, it would have to be approved. And as far as outside the box thinking, I like the idea of trying to do that. I don't have a good idea necessarily because at the end of the day, we have to have a balanced budget, and like I said, we can't obligate a future board, and so trying to come up with some way to meet those needs is difficult to guarantee year over year, especially when you have turnover on the board and different priorities maybe come in place. I imagine any locality probably has those concerns at the very least.
Well, and that may be a good question for maybe I could even do some outreach to Spotsylvania and Stafford because that's what they're doing, and that's what Westmoreland's doing. So how do they do that? I don't know.
At the end of the day, they would have to every year just agree that that's what they're going to do. But I mean, it could change. I mean, just one year they could decide that it's not going to happen. So I mean, it's not I mean, they can't promise it. You can't say it will happen every year guaranteed because you don't have that authority. No one has that authority. But yeah, not that I'm saying it's not necessary or that's not a bad idea. Just wanted to bring that point up. I think it's a pertinent point.
Appreciate that.
All right. I don't have any other questions. Chief, thank you very much for coming out this evening. And I know you have a great deal of support here. Thank you all as well and for your comments. With that, Mr. Cusenberry, I'd like to go ahead and have a short recess. We're coming on 3 hours. I'd like to give staff and our citizen volunteers a break. So if we can reconvene at 9 o'clock sharp, we'll give everyone 10 minutes to stretch your legs and whatever you need to do. All right, thank you. All right, let's go ahead and resume our meeting. We left off at 7, preliminary revenue, preliminary expenditures, general fund. Mr. Kusenberry.
Thank you, Madam Chair. I want to briefly go over some of the expenditure highlights that we've talked about the last few work sessions. There was a request from Human Resources for a new position or a part-time position and software that would cost approximately $20,000 the first year. In the Commissioner of Revenue's budget, we have one new position associated with the cigarette tax and some other costs associated with that, totals around $60,000. Community Development made a presentation to you, and Ms. Hall's pay actions and position requests totaled $301,000, almost $302,000. She also presented two lower cost options that would reduce that by $125,000 or $150,000. Information technology, they have an increase in equipment, but a major increase is in phones and internet, an increase of over $110,000. You heard from the sheriff regarding the new bailiff positions. In addition to that, there will be a new position associated with the cigarette tax, plus the vehicles and equipment associated with that. The new position with the cigarette tax and the equipment is roughly $125,000. You heard from Chief Moody regarding his 9 new positions, and that's funded for that's the cost of funding that for a full year. General Properties had new equipment requests, $53,000 roughly. You also heard from the Department of Social Services tonight regarding the increases that they are showing in their budget. Portions of that will be offset in part with increases in state and federal funding. We talked about the increases to the Rappahannock Regional Jail and the Juvenile Detention Center. In engineering, one option that I want to present is a new position in the county engineer's budget. In 2 years, I'll be really retired. So you do need to be thinking about a new county engineer. And what this proposal would do is to hire a new county engineer, a professional engineer, a young professional engineer, let that person work with me for a couple of years. But that person's major responsibility starting out would be stormwater, because as Ms. Hall showed in her budget, she had budgeted $187,000 for a consultant to do stormwater. And we can do that with a new engineering position, and that person can then be ready in 2 years to take over as a county engineer. Plus, that person can do more than just stormwater.
Like transportation planning a little bit, maybe?
Exactly. That would also be in the job description. Okay. The revenue stabilization fund, we talked about how that needs to be shored back up. And I think what I would propose there is do that over 2 years. The last fiscal year, the county finished with a surplus of over $3 million. I think that's going to happen again this year because of the how revenues were estimated, which was the right thing to do given the uncertainty of revenues and also the vacancies in positions. So I think you're going to see another surplus of $3 million this year, or maybe more. So maybe take $1 million from the general fund surplus last year to put back in revenue stabilization, and then think about doing the same thing the following year in the budget. So in 2 years, you'll be back up to where you need to be. Debt mitigation, I think you need to start putting some money back into that, and a good source of that funding would be the cigarette tax. We talked about health insurance decreased this year, which is good. In pay raises, I think the option I'm going to propose is a merit system going into effect January the 1st, with the performance evaluations being performed in December. And the maximum raise somebody could get would be 5%, but this is budgeted at 3.5% for half a year. We talked a lot tonight about employee retention and recruitment. I think what should happen there is a a dollar amount be put in the budget. I'm not sure of that amount yet, but a certain dollar amount be earmarked to address the recruitment and retention issues for next fiscal year. Again, a source of that's going to be a recurring cost. So a source of that could be the cigarette tax. The capital fund that lowered this year because of the debt service payments. You have new debt that came on board, and the school division will present their budget at the next work session. So the next slide, this shows the FY21 adopted budget, the total there, and the bottom of that is the total minus the schools, the 37 million. And the 2022 preliminary, this includes all of the requests that departments have made without any adjustments by the county administrator. It does not include the new positions. So you can see the increase in the total minus the schools is almost $3 million, not including new positions. Okay, but as you see there, a big portion of that is social services, 1.2 million, and an additional debt service payments of $537,000. That's a significant part of that. So here's some good news for you. The revenue projections next year are looking good. In fact, what we will be, this is very preliminary, but it looks like what we will be projecting in additional revenue next year in real estate, including public service real estate, around $650,000 additional revenue there. In personal property, over $1 million additional revenue, personal property. In sales tax, over $365,000. In recordation tax, and one reason I think you can have a good surplus this year is in the current year budget, the recordation tax was budgeted at 0. And right now, it's around $700,000 so far this fiscal year. And that's likely to continue next year. So, and all these are conservative numbers I'm giving you. So the recordation tax, I may increase that a little bit. Right now I'm looking at $500,000. The local grantee tax, that's another tax through the court system, for over $100,000 there, additional revenue. In the comp board positions, that's the sheriff and the Commonwealth attorney and the treasurer, those positions, that's the funding we receive from the state, that's going to be an additional $200,000. Now, I think the board, when Davenport presented to the board, they talked about a 4-cent tax increase associated with the additional debt for the courthouse. That's going to be 3 cents because of the savings resulting from the financing, a lower financing cost. There was a second reason. What was the second reason for that? Oh, a lower interest rate. That a 3-cent tax increase will do what the 4-cent tax increase was projected to do. In addition, there will be an increase in ambulance fee for services because that is going up, and the county has a more aggressive company that's doing the collections for that. So that additional revenue right there is somewhere in the $3.5 to $4 million range. So next steps. You have the schools that will be coming to your next work session. And also at that work session, I'll be presenting just a general fund budget option. Then I'll represent a operating budget option, including the schools, at an April 7th work session. The board is scheduled to approve a public hearing advertisement at your April 14th work session for the budget and the tax rates. Hold a public hearing at your regularly scheduled board meeting on April the 20th and adopt the budget on May the 4th at a regularly scheduled board meeting. And then at one of your June meetings, the first or second meeting in June, that's when you would appropriate the funding for the service authority, county, and school budgets, and you would also set the tax rates. And something else to bring up is that this year is a reassessment year, and the board can make a decision in the fall after the numbers are back regarding whether or not there will be whether the taxes will be equalized, or if the board wants to do something with that and not equalize and have some additional revenue there.
Very good. Thank you, sir.
You're welcome.
Questions? Mr. Granger?
Yes, ma'am. Thank you. Mr. Cusimir, thank you so much. It's always nice to hear good news as well, so thank you for sharing that. I did have a question. Debt service on the budget comparison shows an increase of 537, and that's because of the courthouse?
That's correct.
So a 3-cent tax increase would actually be
810,000.
okay, because it's about 270%. Is that correct?
That's correct. 270 per penny. That's correct.
Okay, so so if we did 2 cents, it would be about 540,000.
That's correct.
What am I missing?
What you're missing is that landfill revenue is down.
Oh, thank you. That's it. Okay. Yep. Tracking. So, and this was with no positions, you said.
That's correct.
But we've already, I know we haven't adopted the 3-cent tax increase, but I think the board, originally when we were doing the courthouse, kind of came to agreement that we were willing to be prepared to do a 4-cent increase. And so, in a sense, we could remove that increase down a little bit from that perspective, because that was already kind of planned for or anticipated. I have no other questions at the time, though, but yeah, thank you.
Mr. Stonehill?
No questions, just thank you for the presentation.
Ms. Bender?
Thank you very much. But I have just clarification on, you mentioned twice that this does not add the new positions. So all the requests from the departments for new positions would have an increased cost that would have to have a higher tax rate, correct?
Or funded some other way.
Funded some other way. Okay, thank you.
Mr. Bush?
Thank you, Madam Chair. Thank you very much, Travis. 3 things. So under your revenue highlights, general fund, so we did not include looking at a new fee schedule for community development. I think we had that discussion in there too. That
yes, I think she's coming. She's coming at the next work session also.
Okay, so we're going to be looking at that. So that's a potential.
In fact, Parks and Rec is coming to talk about a revised fee schedule also. Both of those will be at the next work session.
Okay, and then in the positions that are currently in the budget, for those that are state employees, that 5% that the state would be putting, is that already budgeted? Because I know Social Services Director had that included in his budget presentation this evening.
Go ahead, Donna.
I don't believe that we've updated the payroll spreadsheets yet
Okay.
to include those.
Okay, and then the last thing, I promise, would be regarding the schools. Do we have any numbers on their fallout funding? What we're projecting would be rolling back into the general fund at the conclusion of this year?
I think it was 440,000, something like that. That was last year. I'm sorry, that was last year. Yeah, not yet. Not yet for this year.
Okay, thank you very much, sir.
Ms. Thompson, do you have any questions?
Just out of curiosity, do we have any idea what the cigarette tax might, I mean, I know it says being determined. I'm just wondering if we have any kind of ballpark whatsoever. I was just curious.
Well, several years ago, we were estimating around $3 million. Jeff, do you want to weigh in on this? We're thinking $4 million now.
It's going to be around 4 million. Could be more than that.
Is that all you have, Ms. Thompson? Okay. Mr. Chapman? Okay. Ms. Huber? Mr. Say?
Let's see, just one question. So there was a lot of discussion during the fire rescue about salaries being way behind. Based on this $3 million increase, how much does that help those salaries?
None,
None.
other than the 5%, up to a 5% merit.
Okay.
All right, I don't have any questions. Thank you very much. Thanks to all of you for everything you've done to work on this.
Ms. Kupka?
Yes.
I
You did say I might have another question. Go ahead, Mr.
I did
Granger,
not this
sorry.
time, but no, I do appreciate it. I would, just based off Mr. Say, so for emergency services, does that include the annual incentive programs?
It does.
That does, okay.
Yes.
But it wasn't like the fee, or not the fees, the step increases or anything? Yeah, okay, tracking. Thank you, sorry.
All right, I don't have any other questions. So if there are no other business to come before the board.
I move to adjourn to win.
Wait, hold on. Stand by, Mr. Bush.
All right.
Go ahead, Mr.
You
Kuchar.
had an agenda item to propose salary range. for
Oh, yes,
county
we did.
administrators.
I'm sorry. Yep, sorry about that. So I've been in touch with our liaison at the Berkeley Group and asked for, well, they started by asking, eventually we're going to get to the point where we're going to have applicants, which we have 8 already as of today. So that's great because it's only been out for a week. But they're going to want to know what the salary might be. And so we want to give them a range. So they forwarded, I asked for some comps from them and they gave a first set, a quick set yesterday afternoon. And then this morning emailed a really nice county by county 2021 survey. So we have a lot of data here to go off of with a recommendation. So first, I just want to defer to you, Mr. Kusenberry. Did you have any recommendation for us, sir?
I asked Donna what you played Dr. Young, and when he left, his salary was around $167 plus a $5,000 per year in deferred comp. When I retired in 2017, my salary was $160 plus $5,000 in deferred comp. I would think you'd want to be at or above that level.
Madam Chair,
Go ahead, Ms. Bender.
I would say agree with that, or maybe just a little bit higher the window, only because we've asked for more experience in the application that we put out for potential employees. We asked for a little bit more education and more years of service. So I don't know what that would be, maybe 165, 170.
He was a doctor. Education.
I gotcha. Any other comments from members? No? Any citizens have any input you'd like to offer? No? Okay. Would someone like to make a suggestion then?
Are we looking for a range or a ceiling?
The suggestion was a range, a minimum and a maximum.
Okay, does that include the deferred comp, like everything? Everything included?
That,
I would make it on base salary because the
yeah, it
benefits
was,
package is going to fluctuate based on retirement,
Talking
health
just salary,
care.
not including.
Yeah, I would say,
the benefits.
I'd say we set a ceiling for base salary.
Okay.
And I'd be willing to go, starting 165 with a ceiling of 180. And that would be for base salary, so your benefits obviously would be on top of that.
Correct. Health insurance, all that jazz.
Which will take us to like over 200,000, so.
Mr. Stonehill.
I like what Mr. Payne was looking at. I mean, I think we should bump that up you know, he's showing 140, 160 as a start. I mean, I'd be more interested like 160 and then stay with his 175, you know. But I would be in the high range of what he's recommending.
Ms. Bender?
I could go anywhere from 160 to 180 because I want to make sure that we get the quality and pay them for it.
Go ahead, Mr. Bush.
I would, so that 180 was the reason I came up with that and that base of 165 is that's our negotiating area. But if we do get that highly qualified individual, you know, it's going to be competitive to be able to get that individual. That's why I wanted to empower the selection committee to be able to negotiate that salary or communicate that to be able to attract that talent level.
Sure. So would we have consensus of the board 160 to 180?
Agreed.
Mr. Stonehill? Ms. Bender? Mr. Bush? Okay, there we have it. I will email them in the morning and let them know. All right, now I think we're ready to adjourn. Sorry about that, folks. Mr. Bush?
I move to adjourn to Wednesday, March 31st, 2021 at 6 p.m. in the Rivercombe boardroom.
Second.
All those in favor say aye.
Aye.
Chair votes aye, motion carries. We are adjourned.